Ladies and gentlemen, please welcome Tari Sekar Pujastuti.
Tari Sekar Pujastuti.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Shalom, Om Swastiastu, Namo Buddhaya, salam kebajikan. Ladies and gentlemen, let me introduce myself. I am Santi Zaidan, and I'll be your host for today's seminar. Ladies and gentlemen, we are still in the series of the first health working group, and now we are starting the side event tuberculosis, prioritizing financing for tuberculosis response, overcoming COVID-19 disruption, and building future pandemic preparedness. May I have your very big round of applause, please, ladies and gentlemen. And to begin this event, allow me to extend our warm welcome to distinguished guests, Minister of Health Republic of Indonesia, His Excellency Budi Sadikin, Minister of Health Italy, His Excellency Roberto Speranza, who is represented by Director of International Relations, Dr. Sergio Iaficoli, Minister of Health and Family Welfare India, His Excellency Sri Mansukh Mandavia, Minister of Health Brazil, His Excellency Marcelo Antonio Cartaxo Quiroga, Director General World Health Organization, Mr. Tedros Adhanom Ghebreyesus, Executive Director of Global Fund, Mr. Peter Sands, USAID Assistant Administrator for Global Health, Mr. Atul Gawande, Vice President for Human Development World Bank, Mrs. Mamta Murthi, Executive Director of the Stop TB Partnership, Mrs. Lucika Dityu, Board of Trustee of Stop TB Partnership Indonesia, Mrs. Diah Satyani Saminarsi, distinguished chair, speakers and delegations, and all guests joining us online or here at Hyatt Regency in Yogyakarta. Good afternoon, all of you, and welcome to our event today. Just now, ladies and gentlemen, we have seen together Sekar Pudiastuti dance performed by Sanggar Kancil Art, which tell the story of expression of gratitude, praise, and prayer to always be safe and given success in our life. This expression is also implied from the music, namely Ladrang Mugirahayu. Ladies and gentlemen, to begin this event, let us commemorate one of a kind statesman who have championed tuberculosis in Indonesia and the world. He led the Partnership Forum on TB in 2013 and established the Stop TB Partnership Foundation in 2018 with the spirit to bring a breath of fresh air in fighting tuberculosis. He aimed to advance the tuberculosis response broadly through a multi-sector approach with strong political support and investment. He also was instrumental in advocating for the publication for the first ever presidential decree on tuberculosis. He is a businessman, an advisor, a leader, a friend, and certainly an inspiration to many who walks in journey of ending tuberculosis. Ladies and gentlemen, please let us now watch the video in loving memory of Bapak Arifin Panigoro.
Inna lillahi wa inna ilaihi roji'un. Telah berpulang ke pangkuan Allah Bapak Dr. Honoris Causa Haji Insinyur Arifin Panigoro bin Yusuf Panigoro.
Bapak Arifin Panigoro dikenal sebagai pengusaha sukses pendiri Medco Energy, perusahaan pertambangan minyak dan gas bumi swasta terbesar di Indonesia. Beliau juga merupakan anggota Dewan Pertimbangan Presiden di pemerintahan Presiden Joko Widodo.
Kita telah kehilangan seorang putra bangsa yang baik, seorang tokoh yang selalu memegang teguh prinsip-prinsip kebenaran, setia kepada negara, dan telah bekerja keras dalam mengemban setiap tugas negara yang menjadi tanggung jawabnya.
Semangat beliau sebagai seorang negarawan tidak berhenti di kancah bisnis dan politik, melainkan berlanjut ke pemberantasan tuberkulosis atau TBC melalui pendirian Yayasan Stop TB Partnership Indonesia.
Kesadaran baru tentang kesehatan di masa pandemi menjadi peluang kita untuk melaju menyelamatkan bangsa dari TBC.
Sosok almarhum Pak Arifin adalah seorang yang sangat humble, rendah hati, sabar dan mengayomi, memberikan contoh kepemimpinan yang sangat luar biasa.
Beliau adalah seorang advokator handal yang mampu membuat perubahan-perubahan besar untuk penanggulangan tuberkulosis di Indonesia.
Saya sebagai Menko PMK tentu saja yang memiliki kesan yang sangat dalam terhadap almarhum Pak Arifin Panigoro adalah keterlibatan beliau, kepedulian beliau, empati beliau dalam kaitan dengan penanggulangan tuberkulosis di Indonesia.
Meskipun Bapak Arifin Panigoro telah berpulang ke pelukan Yang Maha Kuasa, perjuangan beliau tidaklah berhenti di sini.
Bagaimana kita menggunakan setiap detik untuk mengakhiri TBC saat ini akan sangat berharga untuk membangun Indonesia menjadi bangsa sehat, kuat, dan sejahtera.
Kita semua harus melanjutkan, mengadopsi spirit yang telah beliau tunjukkan untuk memberikan perhatian yang sangat khusus, terutama dalam kaitan dengan penanggulangan tuberkulosis di Indonesia yang sekarang masih menjadi penyakit kronis.
Kita telah kehilangan seorang advokator handal, namun kita tidak boleh berhenti sampai di sini. Kita harus tetap meneruskan perjuangan beliau melalui Stop TB Partnership Indonesia untuk mengeliminasi tuberkulosis 2030.
Amanah almarhum Pak Arifin Panigoro, insya Allah akan saya dan tim STPI laksanakan dengan sebaik-baiknya agar apa yang beliau bayangkan, yang menjadi visi beliau, yang beliau cita-citakan untuk kesehatan, khususnya untuk memerangi penyakit TBC, bisa terwujud.
Selamat jalan, Bapak Arifin. Semangatmu akan selalu hadir dalam perjuangan kami untuk mengakhiri TBC di Indonesia, bahkan di dunia.
In loving memory of Bapak Arifin Panigoro, may his passion and determination to make difference in the fight against TB inspire all of us here to never stand still. Ladies and gentlemen, we will start today's event by having keynote speeches and G20 representative speeches, to be followed by 2 sessions. The first session will discuss current efforts and financing towards ending tuberculosis that are not sufficient to meet 2030 target. And the second session will discuss alternative and innovative approaches to expand the financing to end tuberculosis. So now, ladies and gentlemen, we will start today's event with keynote speech from Director General of World Health Organization, Tedros Adhanom Ghebreyesus.
Excellencies, honorable ministers, dear colleagues and friends, I thank the government of Indonesia for its leadership in putting this critical issue on the G20 agenda. Terima kasih. As a high-burden country, Indonesia knows only too well the devastating effect of TB on the health of those it strikes and the health of societies and economies. Tuberculosis kills more than 1.5 million people each year and affects millions more, with enormous impacts on families and communities. Ending this debilitating disease remains a priority for WHO. And in recent years, we have made encouraging progress globally. More than 66 million people received access to TB services since the year 2000. Unfortunately, challenges remain. COVID-19 has reversed years of progress with disruption to essential services to prevent, detect, and treat TB in many countries. As a result of these disruptions, WHO has reported an increase in TB deaths for the first time in more than a decade. Conflicts in Afghanistan, Ethiopia, Syria, Ukraine, and Yemen are further jeopardizing access to services for people with TB and their very lives. Given that Ukraine has a high burden of drug-resistant TB, WHO is working closely with partners to support access to TB care services, including for refugees and displaced populations. Taken together, these challenges pose a serious threat to our ability to meet the TB targets of the Sustainable Development Goals and the WHO and TB strategy. To get back on track, we need strong leadership in high-burden countries and from the international community. One of the main challenges we face is inadequate financing. Today, less than half of the $13 billion annual funding needs are met. Even though we know that investing in ending TB is highly cost-effective. Increasing domestic public financing is the most sustainable way of closing this gap. As part of every country's journey towards universal health coverage, countries with weaker economies, however, have inadequate fiscal capacity to expand public financing, especially following the enormous socioeconomic impacts of COVID-19. These countries will need additional external support in the short and medium term. Let us also not forget that progress in public health depends on innovation. Financing for TB research must at least double to successfully drive discovery of new tools, including vaccines. To intensify vaccine development, building on lessons from the pandemic, WHO plans to convene a high-level summit later this year. Like all investments in health, investments in TB will yield significant benefits through lives saved, healthcare costs averted, and increased productivity. So it's not a question of whether we can afford to invest in TB, it's a question of whether we can afford not to. At a time of many competing crises and huge investments in technologies that kill and destroy, we urge G20 countries to invest in tools, old and new, that save lives, protect health, and enable individuals, families, communities, and nations to thrive. If the pandemic had taught us anything, it's that health is not a cost, it's an investment, not merely an outcome of development, but the foundation of social, economic, and political stability. As His Excellency President Widodo says, investing in TB is one vital way we can recover together, recover stronger. Terima kasih. I thank you.
We thank Director General World Health Organization, Mr. Tedros Adhanom Ghebreyesus, for his leadership in advancing health for all and to end tuberculosis. Ladies and gentlemen, the next one, together with us right now here in Yogyakarta, we would like to invite the Minister of Health of the Republic of Indonesia, Bapak Budi G. Sadikin, to give his remarks on stage. The Honorable Minister Budi, the floor is yours.
Honorable delegates, distinguished speakers, ladies and gentlemen. Between the 17th and 19th centuries, tuberculosis is one of the major killers in the world. It kills 25% of the total death globally. Since the disease tended to run in families, many experts believe that TB was hereditary. But unlike other experts, Dr. Robert Koch, a German physician and biologist, who locked himself for 6 months in his laboratory, discovered tuberculosis bacillus, were the causative agent of this disease on March 1882. Today, 140 years since Koch's discovery, tuberculosis remains a global burden, infecting more than 10 million new individuals each year, of which 2/3 of them are found in G20 countries, and killing more than 4,100 people each day. The world's current investment in TB response and research still leave 30% of people with TB who are missed by the healthcare system and left untreated. This must change. As much as we need to keep our focus to serve TB patients, families, and communities, we must invest smarter to outmaneuver this leading infectious disease killer and to end it by 2030. Ladies and gentlemen, the WHO declared TB as a global emergency in 1993, and the TB global effort have saved more than 66 million lives since 2000. However, the pandemic has weakened many health systems, raised TB death for the first time, reversing years of progress in the history of TB eliminations. As Indonesia assumes the 2022 G20 presidency under the theme Recover Together, Recover Stronger, Indonesia promotes the global health architecture strengthening and advocates for essential TB services restored where we must. First, we need to improve TB surveillance and health information management system. Digital and case-based real-time surveillance system for TB have several advantages over more traditional paper-based reporting of aggregated data. These include enabling the use of automated data quality checks, timely access to data, and the availability of individual-level data for people with TB infections or disease from the level of health facilities up to the national level. Second, we need to scale up and efficiently yet effectively utilize new diagnostic, new drugs, short regimen, pediatrics formulations, TB preventive treatment, and innovative approaches that maximize impact. We need to scale up the use of new regimens, including modified, shorter, all-oral regimens for DRTB. It's an opportunity to accelerate decentralizations and people-centered treatment and improve outcomes by, among other effects, reducing medicine adverse events. Third, we need to invest adequately and sustainably in research, capacity building, technology transfer, better vaccines, therapeutics, and diagnostic for TB. As we see in COVID, therapeutic, diagnostic, and vaccine, we need to push harder for a new TB vaccine. According to current modeling, we will be able to end TB by 2030 if a vaccine becomes available by 2025. Ladies and gentlemen, TB is entirely preventable and curable. We know that. And by improving collaborative networks and multilateral partnerships, we can develop sufficient, effective, and efficient TB diagnostic, vaccine, therapeutics, and surveillance system. Today, I would like to pay tribute to all of you, experts, advocates, practitioners, policymakers, and business leaders for your unwavering commitment and continued support to end the TB pandemic. With this effort, not only will we provide the care that TB patients, families, and communities, but we will achieve the result we all want to see: a world free from TB by 2030. Thank you very much.
Thank you very much, Bapak Menteri, for delivering the remarks. The next one, ladies and gentlemen, joining us virtually, the Executive Director of Global Fund, Mr. Peter Sands, that will be share his remarks. Mr. Peter Sands, the screen is yours.
Excellencies, honourable ministers and friends, good afternoon, good evening to you all. And I want to start by thanking my dear friend, the Minister of Health, Pak Budi, and his team for organising this really timely and important G20 event on tuberculosis. Today, the fight against TB is more important than ever. This disease that has ravaged communities over the centuries is on the increase again, fueled by disruption from COVID-19, by poverty and stigma, and by conflict. I also want to thank the Director General of the WHO, Dr. Tedros, for his message just now on the importance of stepping up the fight against TB, of a sustainable and funded response to end TB for good. And you will find in my remarks many echoes of what he has just said. TB is a disease that for centuries has preyed upon the poorest, the marginalized, the most vulnerable in our societies, has been fueled by conflict, has taken advantage of the fissures, the inequities in all our communities and societies across the world. Yet, prior to COVID, we were making progress, and we had seen a marked step up in progress after the UN high-level meeting on TB in 2018, and there was a real sense of optimism around our ability to beat this dreadful disease. Yet COVID-19 has reversed many of those gains, overwhelming overstretched health systems, diverting resources and political attention from TB. So deaths from TB in 2020 rose for the first time in more than a decade, fueled by a surge in the number of undiagnosed and untreated cases. The number of people being treated for TB globally fell by over 1.3 million. And the sad truth is, the full death toll of that gap we will only see in 2021. Between 2019 and 2020, The number of people being treated for drug-resistant TB in the countries where the Global Fund invests dropped by 19%. Those on treatment for extensively resistant TB, the nastiest version of this disease, dropped by 37%. In a world that is increasingly challenged by antimicrobial resistance, this is the last thing we want to see. TB was and is the second largest infectious disease killer across the world, just behind COVID-19. At the Global Fund, we are acutely aware of the critical role the Global Fund partnership plays in the response to TB. The Global Fund currently provides about 77% of all international financing for TB. And as of now, we have invested over $8 billion in programs to prevent and treat TB. And in the current 3-year grant cycle, we are deploying more than $2 billion to fight TB across the world, a nearly 25% increase on the previous cycle. We also played an active role in the response to COVID-19. While the impact of COVID-19 on TB has been devastating, it could have been much worse. Across the world, we saw communities, governments, partners, all the partnership react and move swiftly to try to mitigate the impact of the pandemic on TB. The reality is we weren't entirely successful in blunting that impact. But if we haven't moved so swiftly, we would have seen more people fall ill, more people die. The Global Fund, through the COVID-19 response mechanism, C19RM, has now deployed about $4.3 billion in addition to our underlying funding for HIV, TB, and malaria to support countries in responding to COVID-19 itself and in mitigating the impact on the 3 diseases, including TB. And so, for example, the Global Fund provided an additional $88 million to Indonesia in 2021 to fight COVID-19 and protect our hard-won gains against TB. Indonesia is particularly strongly placed to lead the world in the global fight against TB. With the leadership of the G20, with the high burden of TB the country has, and with the clear prioritization of the fight against TB by Budi and the government, the president, Indonesia is strongly placed to lead by example in accelerating efforts to end TB as a public health threat by 2030. And in fact, Indonesia can build on a record of impressive progress. Between 2010 and 2019, TB treatment coverage in Indonesia, the number of people treated, diagnosed, nearly doubled from 36% to 66%. And we've been proud to partner and support Indonesia in helping drive this improvement. While the pandemic has been a huge challenge in the fight against TB, it has also been a stimulus for innovation. The Global Fund Partnership has supported the role of bidirectional testing, where people are simultaneously screened and tested for TB and COVID-19. Funding to step up the fight against COVID-19 in Indonesia, for example, has been used to support integrated chest X-ray screenings among high-risk populations. Community health workers have been trained and equipped to offer home-based Team B services, such as supporting patients with their treatments and testing household contacts. These sorts of innovations will outlast the pandemic and strengthen and accelerate our fight against TB in the future. Yet we have so much more to do. The global funding gap for TB is massive. And between us, across the partnership, we need to tackle the issues around the funding gap itself and the sustainability of financing by finding more resilient and sustainable domestic financing approaches, but also by ensuring we maximize value for money in every intervention. And at the Global Fund, we are actively working with partners to explore and deliver innovative financing mechanisms to increase TB funding over the long term and help close that gap. For example, in 2021, the Global Fund helped broker a debt swap, a debt-to-health agreement between Indonesia and Germany, converting 50 million euros of Indonesia's debt to Germany into life-saving investments in public health programs. These funds have allowed for a significant scale-up in TB programs, including those with multi-drug resistant TB. In other parts of the world, we have helped catalyze public-private partnerships in increasing support for TB. For example, in India, which has the highest TB burden in the world, the Global Fund and the India Health Fund collaborate to mobilize private sector funding to further the development of new tools to fight TB and malaria through joint resource mobilization. The India Health Fund is the first platform to aggregate and invest philanthropic capital to accelerate the elimination of TB and malaria in India. And the Global Fund is also intensifying our collaboration with the World Bank, other multilateral development banks, and the IMF to expand blended finance. For example, we're working as we speak with Indonesia and the World Bank on a potential loan buy-down for a program to help fight TB. Funds from this loan could be used to transform subnational interventions to accelerate effective and timely TB treatments. Blended finance transactions have the power to leverage billions of dollars towards health systems improvements, delivering universal health coverage, and reinforcing pandemic preparedness. The Global Fund is the largest multilateral provider of grant funding for health systems. Our investments strengthen laboratories, health worker capacity, supply chains, disease surveillance, data systems, community health systems. These have served as the backbone of the COVID-19 response in many countries, and smart investments in health systems can both fight the diseases that communities face right now, such as TB, and protect people from future infectious disease threats. This year, the Global Fund is seeking to raise at least $18 billion through our 7th replenishment, which is being hosted by President Biden in the United States. Given the role we play in the fight against TB, providing some 77% of external financing, a successful 7th replenishment is critical to ensuring that together we can accelerate progress against TB. If we are successful, when we are successful in raising that $18 billion, we will be able to increase our funding for TB by some 35%. While the bulk of TB financing in the world will come from domestic resources, it is critical to have external support, particularly for the poorer and most vulnerable communities in the world. Now is the time to commit to ending TB. Now is the time to fight for what counts. Let's make this happen together. Thank you.
Thank you very much, Mr. Peterson, for delivering the remarks. And now, ladies and gentlemen, we are going to listen to keynote speech from USAID Assistant Administrator for Global Health, Mr. Atul Gawande. Now, the time is yours.
Good morning, good afternoon, and good evening. It is an honor to be here today alongside so many esteemed colleagues and partners as we work together to accelerate the response to this centuries-old disease through increased political will and greater financial resources. I want to thank the Indonesia G20 presidency as well as the Stop TB Partnership Indonesia and our other partners for hosting this important event. I also want to acknowledge the many distinguished speakers that will have and will be sharing their expertise. I'm honored to be here today representing the United States Agency for International Development, or USAID. We are the lead US government agency and the largest bilateral donor leading the international TB response. USAID works with agencies and partners around the world on the shared goals of reaching every person with TB, curing those in need of treatment, preventing the spread of new infections, and stopping the progression to active disease. During COVID, it's easy to forget that we have another pandemic disease sweeping the world, one that is also airborne, highly infectious, and the cause of deadly pneumonia. I've seen the devastation in operating rooms where I've worked abroad. I've seen people with their entire chest filled with pus from TB. Unlike COVID, this pandemic disease can infect your bones and your brain. It has a death rate of 15% for the newly infected and greater than 50% if it's a resistant variant. But it is an old disease, which is likely why addressing it has not garnered the attention and resources of new infectious diseases. At USAID, however, we've made some of the largest investments in the world to stop TB. There have been strong gains. Since 2000, USAID and partners have reduced deaths nearly 40% and saved more than 66 million lives globally. Our efforts have contributed to tremendous progress, that is, prior to the onset of the COVID-19 pandemic, and now Putin's unprovoked war on Ukraine. We're all devastatingly aware of the social, economic, and biomedical consequences COVID-19 has had on the global TB response as the pandemic ripples across the world and continues to further dim the prospects of meeting the United Nations TB targets and ending TB by 2030. When COVID-19 hit, we saw the whole healthcare system around the world shift to address the new emergency, particularly personnel and services that have been working on TB. Their contributions in this pandemic has been incredibly important. These valuable healthcare workers have made a huge difference on COVID due to their skills and experience in active case detection, contact tracing, and airborne infection control, among other areas. And the fortuitous existence of systems ready to help countries address a new airborne infection has been tied to our long work against TB. In building a strong global response for TB, USAID and our partners were providing countries with the necessary tools to mitigate the impact of COVID-19. We at USAID have invested in building health systems that prevent, diagnose, and control airborne infectious diseases. That's included from laboratory networks and diagnostic tools to community, primary, and tertiary care. Our investments have and continue to cure people and save lives. However, the pandemic demonstrated the fragility of health systems. When countries were locked down, many TB services became inaccessible, particularly to the poorest and most vulnerable populations. As a result, the global TB response was hit hard, losing years of hard-won progress. We now have to do all we can to recover from COVID's impact around the world, and particularly in those countries with the highest TB burdens. USAID has started to do this work. Last year, in high TB burden countries hit hardest by COVID's impact, we supported urgent TB recovery efforts, focusing on increasing access to and improving the quality of TB services. Working alongside national TB programs, the Global Fund, and other vital partners, these recovery efforts focused resources on finding TB cases, with program adaptations including expansions of community screenings, simultaneous testing for TB and COVID, scaling up contact investigations for both diseases, and increasing support to local on-the-ground partners. And with these approaches, we've seen the beginnings of success. To take just one example, in Bangladesh, where there was a 21% decline in reported TB cases in 2020, we adapted our programming to help identify and treat more people with TB by simultaneously testing for both diseases, screening for TB in large industries and public and private health facilities, and addressing healthcare worker shortages, and address long laboratory hours to facilitate more testing. As a result of these efforts, preliminary data shows that the country will report a 33% increase in case notifications in 2021 compared to 2020. These kinds of case studies are still very much in progress, but historically we've seen the difference that such efforts make. In 1950, we cannot forget, TB was devastating much of the world. For example, it was a leading cause of death in Japan. But by scaling up the TB interventions that we know work, by building a strong and resilient national health system, by building in platforms for detection, for treatment and prevention, the country was able to curb TB as a public health threat, and then use that TB effort as a platform for achieving universal health coverage in the country. By contrast, South Korea has made significant investments in the healthcare system, yielding one of the lowest infant mortality rates in the world. But it also has had, in 2010, it was a country that had among the highest TB rates of OECD countries. The TB rate was thought to be a stronghold from the Korean War, but by renewing its political and financial commitments to specifically fighting TB, particularly with prevention measures, South Korea has been able to drive down the country's TB incidence by almost half in the last decade. Over the past century, there has also been a catastrophic correlation between conflict and TB. And now with Putin's unprovoked, devastating attack on Ukraine, we are likely to see it again. Ukraine carries a high multi-drug resistant TB burden. Without ensuring vigilance in our monitoring of the disease and continuity of TB services for Ukrainians and those in the region, we will have continued spread of TB and reversal of hard-won gains. As these examples demonstrate, we need to ensure that while we invest in strengthening overall health systems, we are also investing directly in TB. And that needs to be done with the most effective and evidence-based tools available. For example, while it is well known that finding missing TB cases is one of the most cost-effective interventions to address TB, as it stands, only 30% of notified TB cases globally are diagnosed using rapid molecular techniques. Is what the World Health Organization recommends. The remaining 2/3 don't have access to accurate diagnostics. It's imperative that we collectively strive to invest additional resources into finding individuals with TB quickly using the WHO recommended approach, and then link them to care and treatment and prevent further spread of this disease. It won't be possible to drive change like this without innovative financing and other resources to address the significant funding gaps, the major funding gaps that exist within high TB burden countries. These gaps can result in two crippling outcomes: lack of access to life-saving services and driving people further into poverty. It's not easy to do, but addressing these gaps will pay off in dividends. It'll drive down TB deaths and it'll mitigate health-driven poverty. It will scale up effective tools that can be used to prevent future airborne pandemics, and it will save economies in countries impacted by TB. COVID-19 has shown us firsthand the interdependency of health and economic development. TB overwhelmingly affects those in the low and middle income countries, hindering development and driving individuals, families, and communities into poverty. Almost 30% of funding per TB case comes from out-of-pocket costs, and on average, individuals with TB and their households lose half of their annual incomes, half, as they suffer from and get treatment for the disease, even in places where TB services are provided free of charge. While HIV programs have been successful in driving down out-of-pocket costs, people with TB and their families pay 8 times more for diagnosis and treatment than people living with HIV/AIDS, hampering access to diagnosis and treatment and perpetuating poverty. By increasing political will and funding to cover all TB services, countries can eliminate out-of-pocket medical costs for people with TB and improve labor forces' productivity and social safety nets. COVID has shown us how fast innovations can come when financial and political will are provided. We've seen the positive outcomes that happen when financing mechanisms are available to ensure accessible quality TB services for all. And we've seen the fallout when there is not enough funding to drive innovation and build strong health systems. We must now do all we can to recover from COVID's impact on TB programs around the world, and particularly in those with the highest TB burdens. And we must double down on our efforts to address TB in conflict zones, including now in Europe. This requires strong commitments, including reinvestments in infrastructure to address unmet TB needs and simultaneously contribute to future pandemic preparedness and response. We also need to accelerate TB research and development, and we must invest in both strong health systems and interventions that directly address TB. As we've learned over the past 2 years, we cannot continue to use ancient techniques to address this ancient disease. We must take this opportunity to invest directly in TB through sustainable financing mechanisms and through strengthening our health systems to improve access to TB services and drive down out-of-pocket costs. It's critical, it's vital, it's essential that we all act now to drive the innovation, financing, and commitment needed to end TB by 2030 and prevent future airborne diseases. I want to thank you all.
Thank you, Mr. Gawande, for the speech. The last keynote speech, ladies and gentlemen, will be delivered by the Vice President for Human Development, World Bank, Mrs. Mamta Murthi. Let us listen together.
I want to thank the G20 leadership for the opportunity to participate in this important event to refocus our joint efforts to end tuberculosis globally through increased and better financing efforts at global, national, and community level. TB is an ancient disease, and it was the 13th leading cause of death worldwide and the top cause from a single infectious agent. as per the most recent data. The progress that had been made during the past decade in reducing TB incidence and deaths was significant, and many high-burden TB countries were on track to reach the 2025 TB milestones. Unfortunately, COVID-19 has set back that progress. In fact, it is anticipated now, because of COVID-19, TB will rank as the second leading cause of death from a single infectious agent after COVID-19. And importantly, limited access to testing, care, treatment, and prevention has accelerated TB transmission rates during the pandemic. 10 million people developed TB, and 1.5 million people died from it in 2020. This is an increase in the number of deaths from TB and a slowdown in the rate of decrease of TB. The COVID-19 pandemic resulted in a double shock to health and to the economy. It has cost millions of lives globally, disrupted health services, and triggered a global economic recession surpassing any economic downturn since World War II. While some countries were better positioned to achieve a double recovery in both health and economic growth, at the World Bank, we have estimated that there are over 50 countries that will face significant macro fiscal constraints to maintain sufficient investments in health going forward. These countries will be unable to finance their share of the rollout of COVID-19 treatments and tools, let alone invest in better preparedness and response capabilities. Now, we all know that the costs of strengthening pandemic preparedness can be significant, but they're dwarfed by the potentially catastrophic costs of a pandemic. Investment in preparedness is a global public good, and strong preparedness in one country benefits all others. That's why we have been arguing that as a global community, we need to increase our investment in stronger health systems, especially at the public health level, but also primary health care, because these two, public health and primary health care, are the foundation of better pandemic preparedness. The World Bank's commitment to health systems has been strong over the past decade, and our financing, as well as our analytics, have helped countries address critical health capacities that respond to all threats, including TB. Our analytical work and investments to strengthen the prevention, detection, and treatment of TB are integrated into our health systems work, because what is important is not just how much is invested, but also how it is invested. And although the pandemic has halted progress made, we now have the opportunity to recommit to strengthening our efforts to end TB through strengthening health systems. Let me give you some examples of how we support countries in their fight against TB. My first example is from Southern Africa. Here, the Southern Africa TB Health System Strengthening Regional Project includes 4 countries: Lesotho, Malawi, Mozambique, and Zambia. The project has helped strengthen the regional capacity to manage the burden of TB and other occupational diseases. The project has also helped strengthen country-level and cross-border preparedness and the ability to respond to disease outbreaks. My second example is from Papua New Guinea in the Pacific. Papua New Guinea has the highest proportion of children in the world who are affected by TB. Together with several other partners, we have supported the government in a successful community-based TB treatment program to help eradicate this disease. During the pandemic, laboratory technicians and medical staff trained as part of the emergency TB project were redeployed to COVID-19 response efforts, bolstering the frontline pandemic workforce. My third example is from India. India accounts for almost 25% of the global TB burden, and almost 500,000 people die each year of TB. The World Bank supports the National Strategic Plan for TB in India to improve the coverage and quality of TB control interventions in both the public and the private sector. And it targets several states of India. The program focuses on scaling up of private sector engagement, strengthening of detection, treatment, and monitoring of drug-resistant TB, rolling out of management and support interventions for TB patients, and strengthening institutional capacity and information systems. The program is also supported by the Bill and Melinda Gates Foundation, and it's clear that more bilateral, multilateral, and private partners are needed to step in and strengthen the program further. Despite the challenges posed by the pandemic, both the public and the private sector have worked to ensure the continuity of TB services through sequential COVID-19 waves in India. Finally, let me come to Indonesia. Indonesia is another country dealing with a large TB burden, second only to India and China. The challenge of TB for Indonesia goes beyond the health sector. And as per pre-pandemic projections, TB is expected to cost Indonesia around US dollars 1.7 trillion between 2020 and 2050. It's a very positive step that the government of Indonesia has demonstrated to eliminating TB through the issuance of a presidential decree in 2021. This commitment from the highest level, along with the health sector transformation agenda that is currently taking place in the country, is a very unique window of opportunity to achieve successful containment of TB. As the World Bank, we stand ready to support all countries in facilitating international knowledge sharing, providing analytical and advisory support, as well as financing to address key bottlenecks to lessen the burden of TB. We look forward to continuing these discussions so that we can deepen our support both to governments and working with other key partners in both the public and the private sector. I hope together we can vanquish the scourge of TB. Thank you for your attention.
Thank you, Mrs. Mamta Murthi, for delivering the speech. Ladies and gentlemen, we have just listened to all keynote speeches for today. Thank you very much to the representatives who have given the keynote speech to set the stage for our event today. Before we go to the next agenda, ladies and gentlemen, I would like to inform you that we're going to have 30 minutes coffee break. Besides, we also would like to thank Bapak Menteri Budi Sadikin for joining our seminar today. Thank you very much, Pak. In case Bapak Menteri needs to leave this room due to your next agenda and activities, may all your agenda, all your activities will also run well, smooth, and successful, Pak. Thank you very much for joining this seminar once again. So now, ladies and gentlemen, we're going to have about 30 minutes coffee break, and after the break we will continue to our agenda. The next one is the G20 leadership to end TB with speeches from country representatives, and then it also will be followed with our two main sessions. So ladies and gentlemen, now you may enjoy your coffee break. So we'll see you again at 4:30 p.m. Okay? So we'll see you again, ladies and gentlemen, at 4:30 p.m. Thank you very much.
Bang.
Wow, udah pada kumpul.
Tante.
Iya dong.
Iya dong. Ayo, Om.
Kak, gimana kalau kita minum dulu?
Ayo, boleh.
Sambil nyanyi. Cheers dulu dong.
Cheers. Cheers. Apa kabarnya, Bang?
Ya, begitulah, Mayan.
Yaudah, kita nyanyi bareng ya?
Ayo. Gimana kalau kita main truth order aja?
Ayo, gas.
Lebih seru kan? Aku puter botolnya ya. Ya,
Om kena.
ayo kena. Ibu kena.
Ibu kan gak ikutan.
Ayo lagi.
Ya, kakak kena tuh. Ya, kakak kena
kena
tuh. Kakak kenapa sih? Kok dari tadi batuk-batuk terus?
Nggak tahu nih udah 2 minggu kayak gini terus. Wah, harus segera cek ke dokter, Bang.
Iya tuh bener.
Iya nih.
Setiap orang berpeluang yang sama mengalami TBC. Yang perlu disadari, risiko kita untuk terpapar cukup besar. Semakin segera cek, semakin cepat sembuh. Ingat 14-1 cek TBC. Jika 14 hari batuk tak reda, satu solusi, cek dokter segera. Ayo, temukan TBC, obati sampai sembuh. 14 hari batuk tak reda, satu solusi, cek dokter segera. Segera cek website di 141.stoptbindonesia.org kami.
We are dealing with diseases that knows no borders. We are dealing with diseases that knows no borders.
আমার নাম মোহাম্মদ আসাদ মিয়া। আমার জীবনে সবচেয়ে গুরুত্বপূর্ণ আমার পরিবার। আমি একজন স্বামী, আমি একজন ছেলে, আমি একজন বাবুর্চি। আমি যক্ষ্মা থেকে সুস্থতা লাভ করছি। বেশ কয়েক মাস আগে আমার মা খুব অসুস্থ হয়ে পড়ছিল। তখন আমার পাশের যে ক্লিনিক আছে, ক্লিনিকে নিয়ে গেলাম। ডাক্তার কিছু টেস্ট দিল। তখন এই টেস্টগুলো ছিল খুবই ব্যয়বহুল। তো ওই মুহূর্তে আমার কাছে কোনো টাকা পয়সা ছিল না। তো আমার শেষ একটা সম্বল ছিল চটপটির গাড়ি। সেই গাড়িটা আমি বিক্রি করে দিলাম। বিক্রি করে দিয়ে আমার মার ওই টেস্টগুলো আমি করালাম। ব্লাড টেস্ট করানোর পর বললো যে ব্লাড টেস্টে কোনো সমস্যা নেই, আপনার আম্মাকে সাময়িক এই ওষুধগুলো খাওয়ালে ঠিক হয়ে যাবে। তা 3-4 দিন খাওয়ালাম, খাওয়ানোর পরও কমলো না। দেওয়ার পরে তারপর সুস্থতা শুধু পিছনে যাইতে চায়। ওর মধ্যে আবার করোনা চলতেছে, তখন আমার সম্পূর্ণ ইনকাম সোর্সই বন্ধ হয়ে গেল। এই মুহূর্তে আমার তেমন একটা চিকিৎসা করতে পারি নাই। আমার শেষ সময় যে ব্যবসাটা ছিল সেটা আমার ছেড়ে গেল, আমি সব দিকে অন্ধকারে গেলাম। এর মধ্যে নিজের শরীর অবস্থা তেমন একটা ভালো না, নিজে খুব অসুস্থ বোধ করতেছি। বুকে ব্যথা, সর্দি, কাশি। আমার অবস্থা ওই সময় যে অবস্থা ছিল মানে খুবই কষ্ট, যেটা আমি বলতেছি এটা আমি বাস্তবে অনেক এর চেয়ে বেশি কষ্ট করছেন বাস্তবে ওই মুহূর্তে। তখন আমার এই অবস্থা দেখে আমার পাশের একজন আমাকে এসে বললো যে আপনি ব্ল্যাকের একটা আপা আছে। তখন উনি আমাকে ওনার সাথে যোগাযোগ করিয়ে দিল। টিভি ক্লিনিকে নাম ওনার শাহনাজ আপা। কপ পরীক্ষা করালো, এক্স রে করালো। করানোর পরে সেখানে আমার বললো যে আপনার তো যক্ষ্মা হয়েছে। তবে আমার আম্মার যে সমস্যাগুলো ছিল সেই সমস্যাগুলো শাহনাজের পর দেখে বললো আপনি যে কোনো একটা ডাক্তারে দেখান। তো আমি ডাক্তারে দেখালাম, দেখানোর পর ওই ডাক্তার বললো যে আপনার আম্মার যক্ষ্মা হয়েছে এবং ফ্রিলি ওষুধগুলো খাই। প্রতিদিন 3টা করে ওষুধ আমাদের খাওয়াতো 6 মাস। 6 মাস একটানা খাওয়ার পর তখন আমরা সুস্থ হয়েছি। যেহেতু এখন আমি এবং আমার মা আমরা দুজনেই সুস্থ, এখন আমার মনে অনেক সাহস আছে, শক্তি আছে। আমার একটা দোকান আছে, চটপটি দোকান। আমি মনের দিক দিয়ে এখন অনেক খুশি, আমি এখন সুস্থ, এর বেশি কিছু না। যে কোনো মূল্যে আমি লড়াই করতে এখন প্রস্তুত, আমার পরিবারের জন্য, আমার মায়ের জন্য, আমার নিজের সুস্থতার জন্য।
The doctor said that there's no need to worry because tuberculosis is treatable and curable. I just need to take my medicines and eat well. But tuberculosis makes me feel lost and alone. I miss my friends so much.
Seryoso ba yan?
Oh no. Uy,
Nico.
Nico. Oh, Nico.
Am I strong enough to overcome this? But I was never alone in my journey. I was so afraid I would lose my friends, my love. But I was wrong. They invested their love, care, and support for me. I was so happy to hear that I was free of tuberculosis. The doctor and the health workers helped me live. The medicines and treatment saved me. But most importantly, the hope and love my family and friends gave me helped me beat tuberculosis. My experience has inspired me. I want to invest in ending TB by supporting others in their journey of healing.
Behold, the beauty that is Indonesia, Mother Nature's gift of serene and colorful landscapes, where diversity makes us one, united towards a common goal, where resiliency is achieved together. A strong infrastructure governance arising, where investments are waiting to flourish, and where creativity is inspired by tradition. Indonesia, where beautiful possibilities are offered.
Saya teringat masa saya masih di SMA, itu ada adik ibu saya, paman saya, yang bergejala batuk, kemudian makin kurus, sesak. Kami tidak tahu tentang TB saat itu, jadi akhirnya dianggap sebagai batuk biasa, tapi kemudian ada fase batuknya berdarah, sehingga dibawa ke puskesmas saat itu, tetapi ternyata tidak tertolong. Pada akhirnya paman saya itu meninggal. Setelah di puskesmas baru saya menghubung-hubungkannya, dan saya berpikir jangan-jangan banyak orang di seluruh daerah, di kota-kota, di desa-desa, di banyak negara ini sebetulnya banyak pasien TB tapi masyarakat tidak tahu. Rumah Sakit Persahabatan di Jakarta ini adalah merupakan rumah sakit pusat rujukan untuk penyakit respirasi yang nasional ya. Jadi ada tiga kegiatan yang memang merupakan tugas kami ya. Pertama adalah pelayanan, kemudian pendidikan dan riset. Dan ya tentu saja saya senang sekali bertemu dengan pasien-pasien tuberkulosis, berinteraksi dengan mereka, memberikan harapan.
Menurut saya, masalah terbesar dalam mengurangi TB adalah kurangnya kemauan orang untuk memeriksakan diri. Awal mulanya saya tahu saya positif HIV. Saya menikah dengan suami saya ini. Dan di tahun 2020 saya punya TBRO.
Orang-orang dengan HIV ini sistem imunnya turun, rendah. Sehingga mudah sekali terinfeksi oleh kuman maupun bakteri atau virus apapun yang lain.
Awalnya saya tahu saya punya TB itu, awalnya saya batuk. Selama 2 bulan saya tidak sembuh, dan lalu saya mengajak suami saya untuk berobat ke puskesmas. Saya merasakan efek obat yang sangat berat, sampai muntah-muntah, sampai saya tuh kekurangan darah. Saya rasanya tuh saya udah kayaknya tuh saya udah nggak ada pikiran untuk hidup lagi gitu buat saya yang merasakan masalahnya, seperti takut menularkan ke orang lain, takut merasa dihindari, merasa dikucilkan, merasa dijauhin, ya pokoknya segala sesuatunya saya minder gitu. Saya jarang berkumpul dengan sanak saudara, keluarga, teman, saya jarang keluar.
Dan sekarang bukan saja rumah sakit kami yang sudah melaksanakan pelayanan TB resisten obat ini, tapi lebih dari 250 center sekarang. Jadi ini suatu perkembangan yang luar biasa.
With all the support from the donors country or the Global Fund, we are specially able to establish the TB multi-drug resistant treatment center.
Global Fund itu membantu kita untuk infrastruktur, terutama untuk diagnosis. Karena kita punya gene expert, kemudian kita juga punya MJIT.
We are using this expert machine to test not only for tuberculosis, but including for the COVID-19, especially in the remote area where the PCR tests are not available.
Jadi kalau seluruh lapisan masyarakat, seluruh seluruh lapisan pemangku kebijakan di atas sana juga melakukan ikhtiar untuk tuberkulosis sebagaimana untuk COVID, saya sangat-sangat yakin bahwa TB juga bisa dieliminasi.
Bang.
Wah, udah pada
Tante.
Iya dong.
Iya dong. Ayo, Om.
Kak, gimana kalau kita minum dulu?
Ayo, boleh.
Sebelum nyanyi. Cheers dulu dong.
Cheers. Cheers. Apa kabar, Bang? Ya, begitulah, Mayan. Yaudah, kita nyanyi bareng ya?
Ayo. Bentar. Gimana kalau kita main truth order aja?
Ayo, gas.
Lebih seru kan? Aku putar botolnya ya. Ya.
Om kena.
Ayo kena. Ibu kena. Ibu kan gak ikutan.
Ayo lagi.
Ya, kakak kena tuh. Ya, kakak kena
kena
tuh. Kakak kenapa sih? Kok dari tadi batuk-batuk terus?
Nggak tahu nih udah 2 minggu kayak gini terus. Wah, harus segera cek ke dokter, Bang.
Iya tuh bener.
Iya nih.
Setiap orang berpeluang yang sama mengalami TBC. Yang perlu disadari, risiko kita untuk terpapar cukup besar. Semakin segera cek, semakin cepat sembuh. Ingat 14-1 cek TBC. Jika 14 hari batuk tak reda, satu solusi, cek dokter segera. Ayo, temukan TBC, obati sampai sembuh. 14 hari batuk tak reda, satu solusi, cek dokter segera. Segera cek website di 141.stoptbindonesia.org kami.
Dealing with diseases that knows no borders. We are dealing with diseases that knows no borders.
আমার নাম মোহাম্মদ আসাদ মিয়া। আমার জীবনে সবচেয়ে গুরুত্বপূর্ণ আমার পরিবার। আমি একজন স্বামী, আমি একজন ছেলে, আমি একজন বাবুর্চি। আমি যক্ষ্মা থেকে সুস্থতা লাভ করছি। বেশ কয়েক মাস আগে আমার মা খুব অসুস্থ হয়ে পড়ছিল। তখন আমার পাশের যে ক্লিনিক আছে, ক্লিনিকে নিয়ে গেলাম। ডাক্তার কিছু টেস্ট দিল। তখন এই টেস্টগুলো ছিল খুবই ব্যয়বহুল। তো ওই মুহূর্তে আমার কাছে কোনো টাকা পয়সা ছিল না। তো আমার শেষ একটা সম্বল ছিল চটপটির গাড়ি। সেই গাড়িটা আমি বিক্রি করে দিলাম। বিক্রি করে দিয়ে আমার মার ওই টেস্টগুলো আমি করালাম। তো ব্লাড টেস্ট করানোর পর বললো যে ব্লাড টেস্টে কোনো সমস্যা নেই, আপনার আম্মাকে সাময়িক এই ওষুধগুলো খাওয়ালে ঠিক হয়ে যাবে। তা 3-4 দিন খাওয়ানোর পরও কমলো না। দেওয়ার পরে তারপর সুস্থতা শুধু পিছনে যাইতে চায়। ওর মধ্যে আবার করোনা চলতেছে, তখন আমার সম্পূর্ণ ইনকাম সোর্সই বন্ধ হয়ে গেল। এই মুহূর্তে আমার তেমন একটা চিকিৎসা করতে পারি নাই। আমার শেষ সময় যে ব্যবসাটা ছিল সেটা আমার হাতছাড়া হয়ে গেলাম, সব দিকে অন্ধকারে গেলাম। এর মধ্যে নিজের শরীর অবস্থাও তেমন একটা ভালো না, নিজে খুব অসুস্থ বোধ করতেছি, বুকে ব্যথা, সর্দি, কাশি। আমার অবস্থা ওই সময় যে অবস্থা ছিল মানে খুবই কষ্ট, যেটা আমি বলতেছি এটা আমি বাস্তবে অনেক ইচ্ছে বেশি কষ্ট করছেন বাস্তবে ওই মুহূর্তে।
Ladies and gentlemen, all participants, once again, ladies and gentlemen, and all distinguished guest participants, the side event tuberculosis, prioritizing financing for tuberculosis response, overcoming COVID-19 disruption, and building future pandemic preparedness will begin shortly. We invite you, ladies and gentlemen, to have a seat in the seat that we have been prepared. Thank you.
এবং ফ্রিলি ওষুধগুলো খাই, প্রতিদিন 3টা করে ওষুধ আমাদের খাওয়াতো 6 মাস একটানা খাওয়ার পর তখন আমরা সুস্থ হয়েছি। যেহেতু এখন আমি এবং আমার মা আমরা দুজনেই সুস্থ, এখন আমার মনে অনেক সাহস আছে, শক্তি আছে। আমার একটা দোকান আছে, চটপটি দোকান। আমি মনের দিক দিয়ে এখন অনেক খুশি, আমি এখন সুস্থ, এর বেশি কিছু আর না। যে কোনো মূল্যে আমি লড়াই করতে এখন প্রস্তুত, আমার পরিবারের জন্য, আমার মায়ের জন্য, আমার নিজের সুস্থতার জন্য।
Attention please, ladies and gentlemen. Once again, attention please, ladies and gentlemen, distinguished guests, and all participants. The side event tuberculosis, prioritizing financing for tuberculosis response, overcoming COVID-19 disruption and building future pandemic preparedness will begin shortly. Inviting to all participants to join us in the room, and please be seated. Thank you very much. Attention please, ladies and gentlemen. Once again, attention please, ladies and gentlemen. The side event tuberculosis, prioritizing financing for tuberculosis response to overcoming COVID-19 disruption and building future pandemic preparedness will begin shortly. Once again, ladies and gentlemen, all participants, this event will be started shortly. Inviting to all participants and distinguished guests to join us in the room, and please be seated. Thank you very much. Welcome back, ladies and gentlemen. We are still in the series of side event tuberculosis, prioritizing financing for tuberculosis response to overcoming COVID-19 disruption and building future pandemic preparedness. The next one, we are going to the next agenda of G20 representative speech to know how the G20 leadership position to ENDTB right now. Ladies and gentlemen, our speakers from this session are Ibu Meirinda Sebayang, a MDR-TB survivor from Indonesia, Minister of Health Italy, His Excellency Roberto Speranza, who is represented by Director of International Relations, Dr. Sergio Iavicoli, Minister of Health and Family Welfare India, His Excellency Sri Mansukh Mandavia, and also Minister of Health Brazil, His Excellency Marcelo Antonio Cartaxo Quiroga. So right now, ladies and gentlemen, the first session will be started by Ibu Meirinda Sebayang from Jaringan Positif Indonesia and member of Stop Tuberculosis Partnership Board Communities Delegations. The time is yours, Ibu.
Excellencies, honorable ministers, distinguished delegates, dear colleagues and friends, good morning, good afternoon, and good evening. And thank you for inviting me to this important event and for giving me the opportunity to talk about TB. Having been diagnosed with drug-resistant tuberculosis in 2006, I quickly sought out treatment and quarantined myself in my family home in Bandung, West Java, Indonesia. Although I felt grateful for being able to afford the treatment, the experience was definitely not without struggles. The illness made me so weak, I could not work, and it cost me my hair and even mobility. At just 28, I was unable to walk on my own, and the antibiotics left a lasting adverse side effect that blunted my hearing until today. Left to fight the illness on my own in isolation, I busied myself with leisurely hobbies, if only to fight the depression that I struggle with. I love to sing, I love to paint, and these two pursuits kept me going. I also enriched my knowledge about TB during my quarantine, and for me, knowledge is power. And I kept telling myself that there is nothing in life is to be feared, it is only to be understood. Fast forward 18 months later, when I was finally cured, I started to question the way in which we fight TB today, with harsh and expensive treatments. One would think that a severe illness that was identified in the 19th century would have the less exorbitant cures. Yet, after taking the lives of 1.5 million people in 2020, TB stands shortly behind COVID-19 in terms of mortality rate caused by infectious diseases. Why, then, does the world respond so differently to TB and COVID-19? Compared to the fast progress made to tackle the current COVID-19 pandemic, TB prevention and treatment have not made much progress since its vaccine was developed over 100 years ago. With only one vaccine licensed to prevent the illness, the BCG vaccine partially protects one from severe forms of TB in infants and young children. As for its cure, first and second line treatments are costly both from the financial and health access aspects. In addition, it is not uncommon to hear of serious adverse effects following a TB treatment. Once again, the same pace could not be said for COVID-19. Upon its breakout in 2019 or 2020, governments and multi-sectoral stakeholders from all over the world joined hands to combat the pandemic. And not even a year later, the COVID vaccine was released and vaccination efforts began internationally. And not only that, antiviral therapy for COVID-19 also became available just within a few years. We were able to respond to the COVID-19 pandemic, and more innovative ways to respond to the pandemic continue to be created. Although it has been a difficult journey and many lives have been taken, the COVID-19 pandemic has taught us one vital lesson: that if we were all to join hands, we could respond to crises such as this, including TB, HIV, and other diseases. In this moment, I also would like to express my sincere gratitude to my President, Joko Widodo, on his vision for Indonesia to be vaccine regional hub. And I hope for Indonesia and also other countries of the G20 to cooperate in making vaccine and medicine for equity a reality to address TB, HIV, and also other infectious diseases. Ladies and gentlemen, we need groundbreaking innovations and further investment for TB research, primarily to protect those that cannot access the TB treatment. Regardless of a patient's ability to afford treatment, it is our duty to ensure that health services are equitable, including for TB. If we are committed to investing our time and resources to address this issue, we can undoubtedly develop TB vaccines and treatment that don't cost a cent or one's ability to function, just as it had partially caused my ability to hear. In addition, we also could not end TB without invest more in HIV. TB is the primary cause of death for people living with HIV. Need to expanding access to the latest technologies for TB prevention, screening, diagnosis, treatment, and also vaccination. Let us protect those most vulnerable to the illness by inviting TB-affected communities to the table. They know what they need. We know what we need. And community can help us refine our TB response, both in this moment and in the years to come. TB response must be person-centered approach, which is they must be holistic, empowered, and respectful, encouraging informed decision-making and also self-determination. Let's fulfill their rights to health care, but also to partake in society by abolishing stigma in any form of discrimination or inequality, be it gender or social based. Let's ignite structural change to ensure that TB doesn't disproportionately affect any group or individual. Although TB tends to affect men compared to women, it remains among the top 5 causes of death for women aged 15 to 44 in low and middle income countries. To the national governments, leaders in the healthcare sector, and G20 leaders, this is the time to use your power and influence to address a debilitating illness that has wreaked havoc for centuries. And one fundamental way to contribute is through the 7th replenishment for the Global Fund to fight AIDS, TB, and malaria, hosted by the United States in the second half of 2022. The Global Fund plays a pivotal role in our fight against TB and pandemic preparedness. We need smart and ambitious investments to end TB, HIV, and malaria for good and keep us all safe from future pathogens. And once again, let us change the way we fight TB and let's end the disease for good. Thank you for your kind attention.
Thank you, Ibu Meirinda Sebayang, for delivering the speech. And then the next one, ladies and gentlemen, we will hear the speech from Dr. Sergio Laficoli. Inviting Dr. Sergio Laficoli for delivering the speech.
It is a great honor for me to attend this G20 side event on financing for TB response on behalf of our Minister of Health, His Excellency Roberto Speranza, who is grateful for the invitation but could not participate for overlapping events. According to WHO, in 2019, tuberculosis was the 13th cause of death worldwide and the first cause from a single infectious agent. In 2020, TB is predicted to be the second leading cause of death for a single infectious agent after COVID-19. Projections made in 2020 predict a greater impact on TB death in 2021 and a high impact on TB incidence by 2022. Actions to mitigate and reverse the impact of COVID-19 pandemic on TB is urgently needed. The immediate priority is to restore access to and provision of TB essential services so that TB case detection and treatment levels can return to at least 2019 levels. Overall, around 1 million fewer people with TB were treated in 2020 in countries where the Global Fund invests compared to 2019. Global spending on TB diagnostics, treatments, and preventions in 2020 were less than half of the global target of US 13 billion annually by 2022. In 2001, the Global Fund to fight HIV, AIDS, malaria, and tuberculosis was launched in Genoa, in Italy, at the G8 summit hosted by our country. The Global Fund represents one of the most effective examples of global partnership for development and the most important, dedicated to health. Italy has supported the Global Fund since its inception and has invested over 1.3 billion euro in it ranking as the 9th largest public donor to the Global Fund. As the Global Fund turned 20, we can affirm that its story has been a remarkable success. It is estimated, in fact, that the Global Fund contributed to save 44 million lives. The Global Fund is the leading international funder of TB programs, providing 77% of all international finances for disease. From January 2021, the Global Fund has increased TB grants by 24% on average, and the partnership is committed to deploying more than $2 billion to fight the disease over the next 3 years. During the pandemic, the fund confirmed itself as a key player in the multilateral COVID-19 responders through the ACT Accelerator. COVID-19 has overwhelmed health systems and disrupted health services provision. Because of the pandemic, we are at a critical juncture in the fight against HIV, tuberculosis and malaria. Our resources to fight them have been distracted. Death from tuberculosis rose for the first time in more than a decade, fueled by a surge in undiagnosed and treated cases. Drug-resistant TB is part of the growing challenge of antimicrobial resistant superbugs that do not respond to existing medication, resulting in fewer treatment options and increasing death rate for illnesses that would ordinarily be curable, including TB. Drug-resistant TB now accounts for 1/3 of the world death from antimicrobial resistance. Italy put global health at the heart of its G20 presidency in 2021, and the G20 countries renewed their commitment to strengthen our efforts to address communicable diseases, including HIV, AIDS, tuberculosis, malaria, and hepatitis, as part of universal health coverage and to mitigate the impact of COVID-19. Going forward, Italy will continue to work to strengthen health systems, to enhance access to treatments, and to encourage prevention. Sufficient, sustainable, and predictable funding will be key to reaching these objectives. Last month, the Global Fund launched its 7th replenishment campaign, aiming to raise at least $18 billion to fight TB, HIV, and malaria, build stronger systems for health, and reinforce pandemic preparedness. In the countries where the Global Fund invests, the largest increase in projected funding needs is for TB care. To get the World Bank on track toward ending TB as public health threat by 2030, urgent efforts are needed to prevent and treat TB, including a renewed focus on finding missing people with tuberculosis and successful treating them. Italy looks forward to upcoming replenishment as a moment to renew our commitment and collective actions in the fight against the three diseases. Finally, let me express our full solidarity with Ukraine and Ukrainian people. The conflict is exacting the heavy toll in human lives, displaced persons, healthcare service restructure. Thank you.
Thank you for the speech, Dr. Sergio Iaficoli. The next one, ladies and gentlemen, let us listen together. The speech from Sri Mansukh Mandavia, Minister of Health and Family Welfare, India.
Namaste. His Excellency, Mr. Budi Gunadi Sadikin, Honorable Minister of Health, Indonesia, His Excellency, Roberto Speranza, Minister of Health, Italy, His Excellency Mr. Marcelo Quiroga, Honorable Minister of Health, Federative Republic of Brazil, Excellency Dr. Tedros Adhanom Ghebreyesus, Director General WHO, distinguished participants, invitees, ladies and gentlemen. Greeting to all respected dignitaries. I congratulate Indonesia for hosting G20 First Health Working Groups meeting. Under such difficult circumstances, I extend my heartfelt gratitude to G20 Indonesian presidency for ensuring that the spirit of collaboration of G20 is not frayed by the hardship that the world has endured since the onset of COVID-19 pandemic. The journey of recovery for all of us may seem difficult, but it is achievable with closer cooperation between nations. I extend my admiration for G20 unified resolve to counter the coronavirus. Honorable Prime Minister of India, Mr. Narendra Modi ji, put for the vision of One Earth, One Health at the G20 Leaders Summits in Rome last year and committed to producing 5 billion COVID-19 vaccine doses by 2022 end. For the international community, as part of India's global COVID-19 pandemic response, when the world is battling COVID-19 pandemic, India thanks Indonesian presidency for offering a much needed opportunity to refocus efforts to end TB globally. This session on financing of tuberculosis response, overcoming COVID-19 disruption and building future pandemic preparedness gives us an apt platform to showcase relevant learnings to tackle TB and learn from each other. Let us reiterate the seriousness of tuberculosis. Excellencies, India's National TB Elimination Program felt the impact of the pandemic in its early stage too. There was a shortfall in case notification in 2020 compared with 2019. But the resilience of India's National Tuberculosis Program helped in bringing notification to pre-COVID levels by the end of 2020, by the end of 2021. Notifications show an even stronger surge. Some key mitigation strategies helped India's counter the challenges of COVID-19. These strategies have been implemented domestically, but each of these will resonate with all the delegates present here today. That is because India has been infusing the local for global philosophy across all policy and crisis strategy consideration. For instance, bi-directional screening was introduced to ensure COVID-19 screening among people diagnosed with TB and screening for TB amongst people diagnosed with COVID-19 door to door. Active case finding drives were intensified to screen patients and ensure no household is missed. In 2020, approximately 179 million people were screened and many new cases were identified. Cognizant of the restrictions imposed during COVID-19 management, home-based sample collection services were provided during this time. People of TB treatment were provided with at least monthly supply of anti-TB drugs and were given the option of home delivery as well. The TB programs, nutrition support schemes, Nakshay Poshan Yojana, proved critical for the vulnerable during 2020 and 2021. India made cash transfer of 89 million US dollar to TB patients through direct benefit transfer program. Excellencies, another major aspect of TB mitigation, something the esteemed gathering here must also weigh on, pertains to TB vaccines. As the Health Minister of India, I feel heartened on some developments with several trials on TB vaccines candidates showing promising results. We must also consider the way in which the partnership with private sector can be better leveraged. We have witnessed how effective the private sectors across the world have been while countering the pandemic. Therefore, this approach could be applied on the TB front as well. Technological innovation and forward-looking strategies implemented in the combat against COVID-19, such as rapid development of vaccines, investment in infrastructure like critical care units and molecular diagnosis, coupled with strong political leadership, can be used as an effective template to further inform TB mitigation measures. This will also help us in developing a rapid response to any future pandemic. Serious investment in research and development is also needed to protect our future from similar crises. It's imperative to strengthen our healthcare infrastructure development, new diagnostic and therapeutic solutions, invest in vaccine and broad spectrum antivirals. Through it all, we must remember the need to cultivate more compassion and solidarity. A global pandemic required global efforts. Excellency, I am certain that if all of us present here work toward a collective roadmap for tackling the public health crisis of TB, we will be able to eliminate it just as we have overcome other infectious diseases in the past. Thank you. Jai Hind.
Thank you very much for delivering the speech. His Excellency Sri Mansukh Mandavia, Minister of Health and Family Welfare, India. The next one, ladies and gentlemen, we also will hear speech from Minister of Health, Brazil, His Excellency Marcelo Antonio Cartaxo Quiroga.
Ladies and gentlemen, I'd like to thank the invitation of the Presidency of Indonesia of G20 to participate in this parallel event that deals with such an important theme for Brazil, the need of investing in diagnosis, treatment, and prevention of tuberculosis as a way to ensure the right of all to health and leaving no one behind. Although it is an avoidable and treatable disease, every year around 1.5 million people die of tuberculosis. In 2020, TB has reached around 9.9 million people in the world, especially in the countries of lower and medium income, and among people in situation of a higher vulnerability. Up to 2019, TB was the first cause of death for a single infectious agent, being only overcome by COVID-19 in 2020. The scenario shows the need of, similar to the G20, to destine more attention to neglected diseases, especially our commitment of eradicating TB, including by means of promotion of access or fair and equitable access to drugs of high quality. Brazil is part of the list of the World Health Organization of countries or priority countries for the control of TB in the world, being present in the high burden country list for TB, in the list of high burden for tuberculosis and HIV. The administration of President Jair Bolsonaro has not spared any efforts in tackling the disease. The Ministry of Health has delivered over 420,000 rapid molecular test cartridges in 2021 and over 90,000 treatments by the Unified Health System. We keep working to reach targets such as the reduction of the incidence and deaths in over 90%. Besides the existing challenges, the emergence of the COVID-19 pandemic has resulted in the reorganization of actions, services, and healthcare systems all around the globe, which, according to the World Health Organization, has brought back years of progress in the TB control with social and economical impacts indeed relevant. We highlight especially the decrease in the diagnosis of the disease and the current need for the countries to strengthen their healthcare systems and services, including the early identification of respiratory symptoms, the promotion of quality of treatment, and the training of healthcare services towards biosecurity against airborne diseases. That way, the respiratory issues being by TB, COVID-19, influenza, or other respiratory diseases will be adequately investigated, diagnosed, and treated. The setback in the fight against TB in the context of the COVID-19 pandemic adds to already historical underfunding of the disease, with important deficit of investment in the area of development of new vaccines, new diagnosis methods, and new therapeutic schemes, especially in developing countries that still have hardship to access the technological innovations to mitigate the impact of the disease. In 2020, WHO has estimated that out of the $13 billion necessary to ensure universal access to prevention, diagnosis, and treatment, as well as care with TB, only $5.3 billion were indeed invested. For research, out of the $2 billion necessary a year, at less than $1 billion have been invested. In the past years, Brazil has invested in research and innovation for TB, strengthening the national research centers. The Ministry of Health has partnerships already established with the BRICS countries through the BRICS TB network.
10 minutes left.
Of research. The constant improvement in the diagnosis of tuberculosis with investment in the genetic sequencing techniques is an important structuring action for the expansion of the genetic sequencing for the respiratory diseases such as COVID-19 from the qualification to better training of our laboratories. Regarding the diagnosis of tuberculosis, the investment with artificial intelligence technologies is always more necessary. The access to telemedicine, allowing the remote analysis of X-rays, will aid diagnosis in remote areas. In the last declaration of Ministry of Health of G20, the drug-resistant tuberculosis was listed as one of the main causes of death by resistance to antimicrobials. As a group, we already recognize the need of establishing technical cooperations and investing robust resources and sustainable resources for research and development for tackling TB in order to tackle the challenges and develop new tools, such as drugs and vaccines, while we foster the supply and the production and sustained production of the existing antimicrobials, fostering the production of accessible genetic drugs, and strengthening the national strategies of TB. Brazil believes in the potential of G20 to promote international cooperation aiming at reaching strong healthcare systems, more inclusive and more resilient systems as well, with a clear focus in the promotion of equity, and that way improving our capacity of response towards the elimination of TB as a problem of public health, without leaving anyone behind. Thank you very much.
Thank you once again, ladies and gentlemen. That was the speech from Minister of Health Brazil, His Excellency Marcelo Antonio Cartaxo Quiroga. Once again, ladies and gentlemen, we would like to say thank you very much for the speech of Ibu Meirinda Sebayang. Thank you very much for your strong presence with us here today. Thank you. And also, we would like to thank His Excellency Ministers of Health from the G20 members who have given their remarks for us to step up efforts in ending TB amidst the current challenges. And now, ladies and gentlemen, we are going to enter the first session with the topic, current efforts and financing towards ending of tuberculosis that are not sufficient to meet 2030 target. Yes, ladies and gentlemen, those are our speakers for the first session. And to brighten up this event, may I have your applause, please, ladies and gentlemen? Thank you. Once again, I would like to introduce our speakers for the first session. Teresa Kasaifa, Director of the World Health Organization TB Program. Paula Fujiwara, Chair of the Global Plan to End TB Task Force. Lord Herbert of South Downs, Global Co-Chair of the Global TB Caucus. Bjorn Lambert, Director of the Copenhagen Consensus Center. Madhav Joshi, CEO of the India Health Fund. And ladies and gentlemen, the first session is chaired by the Executive Director of Stop TB Partnership, Lucika Dichu. And for your information, we provide 10 minutes to all speakers to speak and also provide the sound of gamelan instrument just to remind you that you need to wrap up your presentations and also to remind you that the time is over. Thank you. Now the time is yours. Lucika Dichu.
For so many things. It's first time that we have a TB-focused G20 side event. And for this, from all the heart of all of us here, all the heart of everyone that fights TB in the world, but most and important, from all the people with TB that are having an opportunity to be heard and seen at a G20 event, we want to thank Indonesian leadership and Indonesian presidency for focusing on such an important topic that we think is tuberculosis, as well as, even more important, on the financing of TB. My name is Lucica Dițiu. I'm the director of the Stop TB Partnership. I am very honored to be here, part of this event. I'm also very honored for the last months in which we worked shoulder to shoulder with our colleagues from Indonesia, with our colleagues from Stop TB Partnership Indonesia, and all the other partners to contribute a little bit in making this event a reality. As chair of the session, I know that our amazing host said 10 minutes. I would like my speakers to focus and try and speak 7 minutes, because I want at the end to come with a question to each of you in like a take-home message for our G20 colleagues. What will be like your main message to this? We are saying this because tuberculosis, you heard already a lot of it about. I just want to say 2 things as the chair. And I'm lucky to be able to have these 2 minutes to say something. One is tuberculosis was here before COVID. And as we all said in March 2020, we think that TB will obviously remain. COVID will come and go, like it happened with other pandemics, like it happened with other diseases. We were unable till now to make a dent and end this disease. Okay, TB was here for hundreds of years. You had other pandemics and diseases coming in waves. TB remained that. And with COVID, to make things worse, is not that TB remained. TB is now at higher levels than it was when we started, when the pandemic on COVID started. So that's the first thing. The second thing is that as humans, it's a shame on all of us not to be able to end this disease that is curable, for which we have a treatment and diagnosis for more than 100 years, that is cost efficient, as you will hear about it, that we know how to do it, that we have the moral obligation to do it, is just the lack of resources and attention keeping us. If COVID taught us something, is that once you are afraid and once there is an entire solidarity to end the disease, funding seems not to be a problem. Solidarity of researchers to find new tools is not a problem. Mobilization is not a problem. It is time to do the same for a disease that is also airborne and that has a lot of common symptoms with COVID, that will also serve, as it did for COVID, as the platform for starting the efforts to fight the disease through the healthcare workers, through the hospitals, through the dispensaries. Most of us working in TB became the frontline workers in working for COVID. So G20 is a force. G20, I want to tell you, 50% of TB and 60% of MDR TB is in G20 countries. I heard the Honorable Minister of India and Brazil speaking about common efforts, speaking about BRICS. If G20 countries will commit to end the disease in their own countries by 2030 and do the financial efforts and attention to do that, we can focus on the remaining 50% of the burden, probably much easier. The last point I want to make is that I want to applaud India, that since 2017 and 18 called for ending the TB in India by 2025, and the consistent attention and efforts of Prime Minister Modi and the team and the Ministers of Health teams in pursuing this. And I want to say a big, huge thank you to Indonesia, that over the last 2 years, in spite of COVID, pushed a lot of attention for tuberculosis through President, a great pleasure when we met, and the efforts of having a presidential decree on tuberculosis, as well as increasing 3 times the budget, the national budget for the TB efforts. The last thing I want to say is that we have a moral obligation, especially in Indonesia, to continue this fight to end TB and to end TB, because we promised to Pak Panigoro, who was our mentor, our friend, our visionary, and we have to continue to do that. After this introduction, I will just, without too much speaking, I want to give the floor to my colleague, Dr. Teresa Kasayeva. She is the director of the WHO Global TB Program and the brother and sister in arms for me and for all the fighters on TB. Teresa, your floor is yours. The floor is yours. Thank you.
Thank you very much, Luchika, my colleague and close friend. Hope you can hear and see me clearly. So thank you very much. And also in advance, I would say, based on our good relationships, you can forgive me if I will not meet the deadline. So with this, Excellencies, honorable ministers, distinguished delegates, dear colleagues and friends, I would like to thank you for inviting me to speak today. And as all other previous speakers highlighted, this meeting comes at a critical time when COVID-19 pandemic has exposed the fragility of the global responses, including tuberculosis, in the backdrop of the underfunded health systems. TB is preventable and curable, but ending epidemic has proved to be unexpectedly tough. In 2020, around 10 million people fell ill with TB, and the number of people who died from the disease increased to 1.5 million. As our Director General, Dr. Tedros, highlighted, this is the first time we have seen an increase in TB deaths since 2005. And unfortunately, we predict further growth unless urgent measures will be undertaken. The 30 high TB burden countries of low and middle income, accounting for 84% of global TB incidence, have made extraordinary efforts to combat TB and COVID-19. But the demands created by the pandemic have outstripped capacities at all fronts. In 2020, we witnessed a downfall in the number of people newly diagnosed with TB. In those initiated on TB preventive treatment declined, and in the global spending on TB services fell for the first time since 2016. The situation is even worse for children and adolescents with TB. 63% of children and young adolescents below 15 with TB were not reached and not officially reported to have access to the TB treatment services. The proportion was even higher, 72% for children under 5 years. Socioeconomic consequences of the COVID, compounded by the ongoing crisis and conflict in Eastern Europe, Africa, in the Middle East, and have further exacerbated the situation, especially for the most vulnerable. We are deeply concerned for the health of the people of Ukraine in the escalating crisis, given that Ukraine has a high burden of drug-resistant TB. And WHO working together, supporting efforts with the partners to enable access to TB care services for people with TB, including for refugees and displaced populations at risk. WHO is monitoring impact of the COVID-19 on progress towards TB strategy and UN high-level meeting targets, as well as TB notification on a monthly basis. But up to date, there has been insufficient progress made in closing gaps in detection and in the number of people enrolled on treatment. There remains a shortfall of approximately 13% in notification of people with TB compared with a period before the onset of the pandemic. As you know, we are following our core mandate and providing guidance, sharing lessons to address emerging challenges and introduce innovations, including digital technologies, best practices on management TB and COVID-19. On the policy front, we continue to update our guidance on TB prevention, diagnosis, treatment, and care in line with the latest available evidence. In June 2021, we also, to make uptake faster, we've introduced a one-stop shop knowledge sharing platform, and it can help to make the uptake faster, expand this essential knowledge, and it's really critical to make treatment shorter, more effective, treatment outcomes better. It can help to save much more lives, and we should try to use this opportunity altogether. But national TB programs need adequate financing to implement already available policy guidance and to scale up life-saving, cost-effective interventions. For example, despite the strong recommendations from WHO on use of molecular diagnostic technology, rapid tests were only used as initial tests in 33% of all people diagnosed with TB. It's absolutely unacceptable. There are now all oral treatment options, again following WHO recommendation. several times shorter, more effective, fully oral treatment, and still only 1 in 3 people with drug-resistant TB received access to care, and only half of them were treated successfully. The main healthcare interventions available to reduce the risk of TB infection, and we have several effective options for TB preventive treatment. But again, what we can see, therapy provision has regressed, and despite of these available options, we need to see improved systematic screening of contacts at high-risk groups through equitable access to the appropriate technologies such as chest radiography with now computer-aided detection products available. We've just released new guidelines for management of TB in children and adolescents, and they should be implemented as soon as possible. Faster and easier treatment options, including for such severe forms as TB meningitis. The most effective drugs as bedaquiline and delamanid are now proposed according to our guidelines. New decentralized family-centered integrated models of care and prevention. So we have opportunities. Yes, we need more, better, and the more effective, innovative tools. But with the introduction of existing tools, we can do much better. According to our targets, UN high-level meeting targets, we've expected to have at least 13 billion by 2022. Beginning from 2023, according to the global plan developed by Stop TB Partnership with Partners Engagement, we will need now more, close to 20 billion US dollars. But according to the funds available, we have only 5.3 billion globally invested into the TB response. The majority of funding for TB services, around 81%, comes still from the domestic resources, and BRICS countries accounting for 65% of them. It clearly shows that we need more investment, both from the domestic, bilateral, and multilateral resources, and significant increase if we are serious to address TB. We need also additional funding for TB research and innovations. And again, we didn't find by 2022 at least 2 billion. Now we have to find 4 billion per year if we would like to follow our commitments. So this evidence clearly shows saving $1 today, we will have to invest $10 tomorrow. In this respect, I want to share a few points on why investments in ending TB is our best buy. First, investments in TB will avert significant human and financial costs. These are clear investments in TB, and it can avert more than 32 million additional deaths if we will reach our target by 2030. And it can save much more resources, close to 80 trillion US dollars, if we will invest 100 times less on annual basis. Second, investment in TB strengthening health systems and boost pandemic preparedness. TB should be considered, and TB programs, as essential for preparedness strengthening and health system strengthening. Third, TB is fueled by inequalities. Investments in TB can help address other health and social inequalities. We know that almost 50% of patients with TB are facing catastrophic costs. Nearly 20% of global TB incidence is attributable to undernutrition and poverty. Only through multi-sectoral measures and accountability investments from different sectors, we can significantly, dramatically improve situation. Some countries, including our host Indonesia, have established high-level multi-sectoral coordination and mechanism to strengthen a whole of society approach to NTB. This needs to be replicated in other high TB burden countries. Finally, it's difficult to foresee immediate progress without adequate investments in TB research and innovations. Yes, we need better and more effective, still shorter treatment options. But to effectively end the epidemic, we need to stop new TB infections. It means that we need a vaccine. WHO is organizing high-level summit later this year to accelerate development of TB vaccines. And we would like to see again here G20 leadership as a key to make this success. Until we have a vaccine, provision of TB prevention, preventive treatment should be provided and scaled up. We have global strategy for TB research and innovation adopted unanimously by all member states, and it shows clear directions how we should move all together. Excellencies, ladies and gentlemen, the first UN high-level meeting on TB called for adequate financing for TB response, but these commitments have not been met. Next year, countries will have second opportunity to put commitments and follow them. G20 countries will rely on you to mobilize the political will and resources needed to leverage this event and make this a decade of ending TB. You have the full support of WHO in your efforts. I want to thank government of Indonesia for its bold, wise leadership to bring us together and for efforts in general. It's time to invest to end TB and save lives. Together we can end TB. Thank you.
Thank you, Teresa. Thank you very much for being with us and for making live this speech. Actually, this entire panel, I'm really grateful that everyone is joining live because it's really good. We feel a little bit like being there with you in Indonesia. And great that we are putting all our hope in getting also, in addition to all the other funding, a joint effort to have a vaccine to end TB by 2030. And speaking about long horizons and speaking about where we want to go, Paula Fujiwara, one of the most known senior technical experts in the world on tuberculosis, led the global task force on developing the global plan to end TB by 2030. And I know that Paula has a presentation, and I see that I think you are organizing this. As of now, I don't think we see an agenda. I don't know if you are, can we have Paula's presentation? I think there is a preparation with it, if I can.
I'm trying to share my
screen.
My screen.
You are sharing.
I know. I'm not sharing what I need to share.
I think it's coming something.
Here it is.
Yeah.
Okay.
Why don't you go ahead, Paula?
Okay, thank you very much. Well, thank you for giving me this opportunity to talk about the crucial needs and gaps that must be addressed to end tuberculosis. I'm going to be talking about the global plan to end TB for 2023 and 2030, the resources that we're going to need, much of which was Dr. Kasayeva just spoke about, but I'll go into a little bit more detail, and some of the potential funding sources. So this global plan to end TB is the 6th iteration. It's going to go until for 8 years instead of the usual 5 years. In September of last year, the Stop TB Partnership Board requested an updated costed plan, and then we will present this plan in May of this year. This has been a very inclusive process. You can see by the pictures on the screen that some of the members of the task force, this has diverse expertise. It meets monthly, but it consists of people with the national TB programs, private sector, lab people, economists, and most importantly, modelers, and most importantly, civil society. We've had 2 online surveys to understand what people really want to know about the global plan and what they've been using so far. We've had 8 regional consultations in English, Spanish, French, Portuguese, and Russian. We are working with the modeling team, who in turn we're working with the Global Fund investment case, and I am in charge of the writing team. There's going to be a new focus on pandemic preparedness and vaccines. So we are off track. If we're going the current trend of global trend of decline, we're only going at 1.5 to 2% per year in this red line. And as was pointed out by Dr. Kasayeva, we have to use the current tools and we have to optimize them. And if we do that, we can have a 10% decrease by 2025. And the vertical line of 2025 shows that when we hope we will start to be introducing new tools, particularly the vaccine. And the goal is to get to the 2030 SDG target of 90% decline in deaths and an 80% decline in incidence rates. Now we can end TB despite the fact that COVID-19 has really affected it. However, It's all hands on deck. We're going to need increased investments in diagnosing and treatment all people with tuberculosis, so no one is left behind. And we're going to have to really deal with early diagnosis. And by early diagnosis, I mean not just TB infection and TB disease, but all of those people in that pathway, including subclinical stages. We're going to have to scale up the TB preventive therapy. And obviously, a new vaccine post-2025 is going to be absolutely crucial. But another thing in terms of pandemic preparedness, we really need to put TB at the center of that response. So what kind of resources do we need? Between 2018 and 2022, right now, the average U.S. amount is going to be, it has been $13 billion a year. However, from 2023 to 2030, we're going to need $19.6 billion per year. And the additional costs are going to come from the vaccines, which are going to be $53 billion total, and an additional $2 billion per year for R&D. However, as you know, we've all been hit by the COVID pandemic. TB has been hit in particular. But if we look at the funding for COVID in the last year, the data keep changing because the numbers keep increasing, but worldwide there's been a $9.177 billion investment in R&D alone for COVID. And there have been over 1,000 candidates for diagnosis, treatment, and a vaccine. And if we think about the pandemic preparedness issue, then we have to know that the group called CEPI, which is the Coalition for Epidemic Preparedness and Innovation, which was launched in 2017, and they only had 430 million. And then this was accompanied by the WHO's Disease X funding of 268 million. Now we have COVAX. They don't talk so much about the amount, but the doses of vaccine. But the U.S. government, for example, has invested $4 billion in this. So what are the resources? What do we need? We're going to need approximately $230 billion from 2023 to 2030, another $53 billion, as I mentioned, for the vaccine, and the additional $20 billion for research and development. What is this going to buy us? This will achieve 50 million people with TB that are treated, and that includes 3.7 million children. We're going to have, that includes 2.2 million people with drug-resistant tuberculosis that's treated, and that means that more than 95% of them are going to be diagnosed, and everyone is going to be started on treatment. Over 90% are going to have a successful treatment outcome. All of the eligible contacts, and including and especially people with HIV, are going to receive TPT, and 4.4 billion people will receive the new TB vaccine. And that will get us to the goals of the SDGs. There is ongoing work, however, in preparation for May. We have to finalize the R&D costs. We have to calculate the additional number of lives saved and the new return on investments, which traditionally, if we look at the current plan, which the return on investment was $44 for every dollar spent, it's always been, TB has always been a very good investment. In terms of the additional sources of funding that we're going to need, domestic budget increases are going to be needed. I think the minister from Brazil talked about the BRICS making their contribution, but other countries with high burdens will also have to make additional contributions. The Global Fund has traditionally been the largest external funder of TB funds, but it only gives 18% of its funding for tuberculosis, maybe even less now. We're going to have to think about loans and think about them creatively. Blended loans, buy-down loans, debt swaps, and innovative financing. Also involve the private sector, get those high net worth individuals like Elon Musk, who has promised to give money for another condition, social health insurance, and new sources of external funding besides the Global Fund. And we also have to remember that we're going to have to get the money for the research. What if we don't do what we need to do? We have seen the devastation that has been caused by COVID, another airborne disease. TB is in that same picture, and it also has drug-resistant invariants. But we do not have, as is COVID, all of the new drugs and everything to actually treat them. We don't have that pipeline. And this is going to have enormous implications for global health security and antimicrobial resistance. If we don't deal with this, people will die. People will continue to suffer. And it's a matter of pay now or pay later. If we don't do it, as Dr. Kasevich just mentioned, it will cost us more. So to the G20, to the ministers, to the heads of state, just 16 words. You treat all people with TB well, you use the new tools, you make the investment, and you keep your promises. Thank you.
Thank you so much, Paula. Also, in a way, you already gave us the take-home messages, which I think are extremely comprehensive. And thank you for highlighting what it means if we don't get these investments. I know that we have with us in our panel and live with us from UK, Lord Herbert of South Down. Lord Herbert is one amazing champion for ending tuberculosis, for years pushing the agenda, the political agenda, because he is the global co-chair of the Global TB Caucus, and I would say not only a great friend of all of us and people with TB, but actually the engine in pushing a lot of the commitments and a lot of engagement from the parliamentarians and decision makers in this. Nick, it's an important moment today. Why don't you share with us your thoughts and vision, please?
Luchika, thank you so much. And thank you so much for allowing me to join this very important and timely meeting today. And I'm only sorry that I can't join in person. I have to be at our parliament later today, and I'm traveling to Mexico on Thursday, and I just couldn't make the timings work. It's an important session, I think, this, because it asks the question whether efforts and financing are sufficient to beat TB. And of course, we know that they aren't. And we don't have to rehearse that at length, but we're way off track to meet the SDG to end TB in just 8 years' time. And I think we have to be realistic and recognize that in spite of the high-level meeting, which was so important and a success a couple of years ago, even if COVID hadn't intervened, we would have been off track. And of course, COVID knocked us very seriously off course. And in the end, our ability to end TB around the world is dependent on resources, and the resources that can be committed both multilaterally and in country. And in turn, those resources are a reflection of political will and the level of political commitment that is necessary to beat the disease. And why I think the role of parliamentarians is important is because, as I have said many times before, members of parliament do pass the laws. We often vote the money and approve budgets. We do have the ability to influence what's happening in our own parliaments and governments, to talk to and to get access to not just health ministers, but finance ministers and leaders as well. And I think that we are stronger when we work together. And that means working together within our own parliaments, and the formation of many more TB caucuses now is a very encouraging thing, but also working together globally where we need to. And I think a good example of that has been in relation to the G20, where as a result of the liaison that the Global TB Caucus has been able to do, working with our partners and working with Sherpas, we've helped to secure the acknowledgement of TB on successive G20 health declarations since 2017, and actually on leaders' declarations as well. And we need to continue that work. And that's an example, I think, of where our collective action is really important, and that's the work across parliaments. It's ensuring that we coordinate in what we are saying to our individual health ministers who have responsibility and influence over that G20 agenda. So we have some very sort of practical and targeted things that I believe we need to do to maintain that pressure. Of course, the attention of leaders, of finance ministers, of health ministers has been on COVID. And it's important that we're able to articulate the case, which many have been doing over the course of the last few days, for a focus on TB, not because we are trying to say, look, you need to take your attention away from COVID, here's another pandemic as well, but because actually in the end, we need a concerted effort on global public health to beat all of these diseases, and we need to be doing many of the same things together. And whether it's in the efforts to boost research and development, as Luchika said in her introduction, where we've proven that investment can secure the scientific advance that's needed, or whether it's in the strengthening of surveillance systems or of health systems themselves. We need to try and persuade ministers that they don't face alternatives here, that actually all the things they need to do to ensure future resilience to beat another pandemic that might be around the corner, or indeed to tackle existing pandemics, are things that will help beat tuberculosis, but also help things that will beat HIV, AIDS, and malaria, and so on, and not set ourselves up as some kind of sort of competitor. And I think it's very important that we are able to articulate that case and constantly remind ministers that there are existing pandemics which are in need of tackling as well, but are also part of the solution as well in terms of what needs to be done. I think parliamentarians are at our most effective when we are using our lobbying and convening power. We are ourselves not expert on TB, and many of you here are. But what we can do is open doors, convene meetings, get help to push efforts. And I think where, therefore, we are working with other causes that effectively need the same thing, so whether it's alongside our colleagues who are concerned about HIV, AIDS, or malaria, in calling for replenishment of the global funds. We've just done that, for example, in the UK Parliament. Working together, we've sought to press the case for replenishment, and will continue to do so. Whether it's in working with, in partnership with academics to give academics the access and profile that they would like in order to persuade ministers of the need to act and to help them to amplify the case that they need to make. Again, we've just convened a meeting in our UK Parliament to try and to try and do that. Whether it's opening up what I think would be a profitable new partnership, which would be with business, which parliamentarians haven't done as much in relation to TB, but where I think we should. There's a very good new grouping, Ending Workplace TB, that is seeking to mobilize the business community in the action that it needs to take to tackle tuberculosis. And I think parliamentarians could usefully work with that organization and with businesses, because they are part of the solution when it comes to mobilizing the financing that is needed. So I think that parliamentarians need to be ready to work within our own parliaments, yes, together across our parliaments, yes, but also with our partners. Whether that's our partners in country or whether it's our partners multilaterally, I think we've been at our best when we've been working very closely with our friends and allies and helping to open the doors where we can. And we stand ready to continue to do that. There are obviously some very key moments ahead of us. And looking beyond the G20, there's obviously the replenishment of the global fund that I've mentioned, which is going to be challenging because of the position that all treasuries are in as a result of the expenditures on COVID. We need to do a lot of work within our own parliaments to make the case for replenishment, and then we need to work together to be supporting the Global Fund's case. And so that's obviously going to be a big focus for us over the next few months. And then there will be the review of the high-level meeting and trying to get the world back on track on the commitments that were made there. And the Global TB Caucus played quite a role in relation to the high-level meeting before, using our efforts to lobby diplomats and so on, lobby within our own governments, lobby for attendance, lobby for commitments. And I think that we will need to do the same thing. And so, again, we stand ready to work with our partners, key partners, such as the WHO, such as the Stop TB Partnership, and so on, to ensure that the meeting, to review the high-level meeting and to check on progress and to effectively to try and reset after the turbulence of COVID is as successful as possible. So I know we have a very important role to play, and we need to work hard to continue efforts in countries to rebuild our own caucuses in countries where they are less active, to work hard, particularly to make certain that we can maintain our strength, to work with our allies. And I commit that the Global TB Caucus will do everything we can at this crucial time. You know, TB has really, the fight for TB, it's taken a tremendous knock because of COVID. We were in a difficult position beforehand. We're in an even more difficult position now. As Murthi, I think, said, you know, if we had a mountain to scale before, it's Everest now. But Everest was scaled, can be scaled, and if we work together, we can do it. And I want to once again say that the parliamentarians will do everything we can to support your efforts, so that together we can work to end TB and get that effort and in turn the resources flowing that are needed to beat this disease. Luchika, thank you very much indeed.
Thank you so much, Nick. A bit over time. I'm being told by our colleagues. I don't know if I will have time to go back to everyone for a minute at the end, but thank you very much. Nick, as always. I think it's also very important to underline that a good metric for all the work with parliamentarians is the number of laws and legislation that mentions TB, as I think you are targeting as well. You know, at national level, that will be really as happened already in few countries, and as we know in Indonesia. We know that for parliamentarians and for decision makers and for the ministers and for the prime ministers, it's very important to speak their language, and nobody will understand our TB technical language. But people with money might understand some economic language, and that's why I'm very happy to have with us Bjorn Lomborg. He is the director of the Copenhagen Consensus Center. This is an economic think tank with several leaders in economic world, including some Nobel laureates and including some great minds in terms of looking at the finances. And Bjorn will tell us, you know, you heard us, some of us here are very TB people, let's put this way, focused. Bjorn comes from a broader perspective. Please, Bjorn, share with us your thinking around the costings and the money and, you know, the overview on TB financings and so on, and impact and efficiency. Sorry.
Thank you very much, Luchika, and thank you very much to Indonesia for setting all of this up. Thank you to all the G20, Your Excellencies, ministers, ladies and gentlemen. It's great to be here. I'll just share a quick version of what I think is important, and I'm hoping that you can actually see my slide. You can? Good. Great. So I basically want to talk to you about why TB is one of the very best investments in the world. And as Luchika just pointed out, look, there's a lot of people within TB that really cares about TB, which is not very surprising. But of course, there are a lot of other people in all other areas of the SDG. What we need to be able to show the politicians that we just heard telling us where should we be investing our extra money is basically that investing in TB is one of the best investments in the world. So one of the things that I do, and sorry, I just need to be able to shift, is is I work with an organization where we focus relentlessly on cost-benefit analysis. We try to say, where can governments and where can individuals like Bill Gates or you spend your money and do the most good? This is called the Copenhagen Consensus. We've been doing prioritization for more than 15 years. We basically ask, where will the next rupee or next dollar do the most good? We work with, as Luchika pointed out, more than 300 of the world's top economists. We've worked with 7 Nobel laureates. We've applied this across a wide range of areas, both in Haiti, Bangladesh, India, Ghana, Malawi. We've just recently finished in Uganda. We've tried to look at specific areas where to fix climate, health, and HIV. But crucially, what we've been doing and what I want to tell you about is to say, look, there is all these promises in the SDGs. We're not going to be able to do all of them, so maybe it would be a good idea to start talking about where can we do the most good. Remember, there's 169 targets, and not all of them are equally effective in delivering an extra rupee and then doing a lot of good for the world. So what we did was, together with 50 teams of economists, and you just see the outline of all the things that we looked at. We had academics across a wide range of areas ask, where can you spend a dollar and do the most good? Where can you spend a dollar and only do a little good? We basically tried to identify what works best. But of course, again, this doesn't work unless you also get this information out. So we work with tons of newspapers across the world. This is from the East African, as you can see. We basically involved all of them in knowing about all of this research that I'm going to share with you. But the crucial bit is to simply say, some things are amazing, some things not so much. We've also published a big book with Cambridge University Press, and if you're interested, you might want to pick up the short one, which is The Smartest Targets for the World, which basically just quickly runs through what are the best investments for the world if you ask some of the world's leading Nobel laureates to investigate. This is the total outcome. And again, I'm not asking you to look at all of this, but it gives you a sense of all the different cost-benefit analyses we did across every area of the SDGs. And crucially, as you can see here, I'm highlighting it, tuberculosis was one of the best investments. What this basically shows is that for every dollar spent, how much social, economic, and environmental good do you do for the world? Long lines are amazing investment, short lines, not so much. And basically it tells us TB is one of the best investments. I just briefly want to tell you how come. Well, we look at the costs. So we work with tuberculosis experts and health economists to look at what's the cost of latent TB screening. We found these numbers. Again, I'm not going to bother you with the individual numbers, but as you can see, we come out and showcase how much will this cost. We look at the treatment and drugs for drug sensitive, which is fairly cheap. We also look at TB treatment for multi-drug resistant, which is, as you know, a lot more costly. What we find is if you're actually going to treat most people, this will have a significant cost. Now, remember, this was back in 2015. We're updating this shortly together with Stop TB and a lot of other people. We also look at the benefit. The benefit basically is that most people will survive, and they'll survive much longer. Of course, we don't avoid death, but we give people another 20 years of life on average. That's an amazing achievement. How do economists evaluate that? Well, we have different ways of looking at it with DALYs. We look at both setting a value of a DALY at $1,000 or $5,000. We also use different discount rates. As you can see here, I'm simply showing you what the outcome of the benefit per person saved. But what we basically estimate is saving a person is worth $38,000 per person saved. The cost is about $900. So if you look at how much did your dollar benefit for every dollar spent, you delivered $43 of social benefit to the world. This is language that finance ministers and everybody else understands. We're spending tax dollars and delivering huge paybacks. We also did this for India, and I just briefly want to share this. We did this together with Tata Trust, both in Rajasthan and in Andhra Pradesh. I'm just going to show you the outcome from Rajasthan, where we worked together with some of the top economists in India, including the chief economic advisor to Modi, Ghebreyesus, as you can see. And what they found was that tuberculosis was the best investment for Rajasthan. Why? It kills about 40,000 people every year. And this is to a very large extent because a lot of people go to private care and typically get substandard treatment. The National Strategic Plan says, yes, we should engage with private providers, but there's still a long way to go. What they find was if you give subsidies for high-quality diagnostic tests, free TB treatment for all those treated in the private sector, adherence support so we actually make sure people stick to this, and provider support so we actually know how many are stuck with TB, it will only cost $2 million, but it'll provide benefits for almost all of these at about $373 million. So every rupee spent or every dollar spent will deliver 171 rupees or dollars of social good. That's a phenomenal return. Again, we need to get these numbers out for people. So remember, we're almost at the halftime for the SDGs. We promised all these things we're not going to be able to deliver. We have to ask ourselves, all right, next year, we're going to be at halftime for the SDG, but we're going to be nowhere near halfway. We need to say, if we can't do everything, what should we do first? We should do the smartest investments first. We should spend money where it'll actually deliver the biggest bang for the buck, the most human benefit for every dollar spent. And one of those investments in TB. So, Luchika, I'm simply going to give you the 1 minute point you wanted to say. No matter which way you slice it, it is simply such that spending on TB smartly is one of the best investments that you can do for the SDGs. So, excellencies, honored members, ministers, everyone here, we should go out and broaden this message. Yes, there are a lot of things you promised. You're probably not going to be able to do all of it. Make sure you spend it on the smarter stuff first, and TB is one of them.
Bjorn, thank you so much for this, and also coming from you with the credibility that you and the group you lead has. I imagine that I imagine that for our audience means a lot, and I will add my voice to yours in saying, let's spread this message that people understand that we are not a group of people trying to spend money without really having the very solid background behind, which for investors and for finance people mean a lot, which is basically return on the investments and the smartest investments first. So you mentioned India, and we had already a speech from the Minister of Health of India. But in this panel, we wanted to have as well the voice of a finance. We wanted to have the voice of a person that is or a representative of a group that looks at health financing in a different way. And I'm very happy to have here a good friend of us in TB world and in Stop TB Partnership, Mr. Madhav Joshi, representing the India Health Fund. And sir, if you can share with us about what you do, but also the focus on TB, please. Thank you so much.
Oh, good afternoon, good morning, good evening. And Dr. Titu, thank you very much for the introduction and for the invitation to join this session. I'm going to be sharing a couple of slides, so please bear with me while I pull them out. And I'm hoping you're able to see them. Awesome. So I represent an organization called India Health Fund. And I'll be talking to you about how India Health Fund has been playing a role with as the private sector in addressing the response to tuberculosis. Just by way of background, we're a fairly unique organization set up as a partnership between Tata Trusts, which is the oldest and the largest philanthropic foundation in the country, who came together with the Global Fund. And when they came together, it was on the thesis that communicable diseases had suffered from market failure over time. And the market failure was particularly in the availability of patient capital that was needed to take promising technology from lab to market. So Tata Trust has seeded India Health Fund with active collaboration with the Global Fund to really focus on de-risking the development of promising technology, which can improve outcomes in the diagnosis, treatment, and prevention of communicable diseases. And it's not just about innovation development. It's also about using the seed funding that the trusts are providing as leverage to really bring together like-minded partners in creating a pooled financing mechanism, not just for India, but for the rest of the world as well, to really address the challenge of communicable diseases and also other public health threats. And in doing that, create new business models, partnerships, and financing means that can help these solutions scale, because it's not just enough to support development. Scaling is important. So our theory of change uses innovation as a means to an end. And the end is to reduce preventable deaths from infectious diseases. The approach we take is to identify promising technology which has demonstrated proof of concept and de-risk the development of that technology using grant funding, which enables both the clinical development, the clinical validation, as well as evidence which generates good use cases. And I think, as Bjorn has, pointed out very eloquently, TB is a good investment. But in using the private capital that we do to de-risk that development, we are then able to enable the adoption of these solutions in both the public and the private health systems through partnerships and collaborations. And those partnerships and collaborations have resulted in improved access to affordable means of diagnosis and treatment, which are giving better accuracy, as well as doing this in a resource-efficient way, because we look at resource efficiency in a few ways. We don't just look at technology for particular diseases. We look at technology as platforms which can then be applied to multiple diseases. And our focus is particularly on using these solutions as a means of strengthening health systems with a focus on primary care in order to improve delivery at the last mile, particularly in resource-poor settings. And in doing that, our focus is really to reduce the number of preventable deaths, particularly by increasing the number of patients who are diagnosed, who are treated, and in the long term, really bring together synergies from the various players who are very active in the health system, but probably acting in a more fragmented way than would be necessary to really bring the outcomes that we seek. I'm going to illustrate this by way of a case study, which is fairly recent. So one of the biggest challenges in the TB world is early diagnosis. We have supported the development of a smartphone-based application which can scan an analog chest ray and digitize it. And this is then linked to an AI algorithm, which we have supported the training of. So the algorithm has now reached a point where it can detect TB with 90% accuracy, which has been calibrated with traditional methods of diagnosis, whether it's through cultures or molecular diagnostics tests. Our support has enabled not just the development of the algorithm, but the validation of the algorithm in 100,000 patients across the country. And as of today, our support has ensured that over 20,000 patients have been screened. But more importantly, the referral time for collection of sputum has come down to 2 minutes from 2 days, which is what it was earlier. That's enabled the health system to detect 33% more cases in an environment where we are challenged with a decrease in the number of patients being screened. And patients are now being enrolled for treatment within a day as compared with 4 days. Now, this is what patient capital from the private sector has allowed. But the scaling up it has enabled is even more important. And the Stop TB Partnership has now supported the scaling up of this detection method in 100,000 patients in the city of Mumbai, which is one of the worst affected cities for tuberculosis anywhere in the world. And the Global Fund is now supporting scale up with 50,000 patients at 100 municipalities in the Philippines. The government of South Africa is supporting this among TB patients in South Africa. It doesn't stop there, because the algorithm that we have supported development for tuberculosis has now been adapted for COVID and is now being used for bidirectional screening of TB and COVID, which has been mentioned during the course of this discussion. It's also been adapted for lung cancer and also for COPD. And this has allowed Fujifilm to now integrate the algorithm in their portable X-ray devices, which are being rolled out across the world. So there will be instant diagnosis with every X-ray that's taken. And AstraZeneca is now supporting the rollout of lung cancer detection using this algorithm in 30 countries around the world. So we're very pleased to see that the catalytic effect of the de-risking that we have put together at risk is now enabling a larger ecosystem to come together to really support both the development, the adoption, and the scale of this. And I think that would lead me to a couple of thoughts that I'd like to table based on our own experiences. There is public-private partnerships, particularly in the area of TB, and financing the TB response are possible. But we found that they are most effective when there's active collaboration both locally and at the global level in aligning on the big bets that really need to be financed. And then ensuring that long-term patient capital is available, not just for the de-risking, but also creating use cases. And I think the COVID vaccine has been a very good example of how alignment on a big bet has actually enabled patient capital to allow de-risking as well as development. We're doing that in our own way at India Health Fund, but the opportunity is to do this much harder and much wider across the world. And it's not just about development, it's about adoption. And this is where global really comes in. If we can create global use cases, then these innovations can scale more effectively with viability gap funding, which makes it possible for the private sector to really kick in early rather than wait for scale. And lastly, a thought for the G20 forum is to really consider creating a network of enablers like India Health Fund, which can bring these solutions, which can take solutions from closer to the ground, but also work in a coordinated way to enable both their development as well as their scale. And use blended finance as a means to not just support development, but adoption and scale. Because at the end of the day, this is a shared responsibility that we all have. So that's what I wanted to share about India Health Fund, our experiences and maybe some thoughts. And thank you very much for your time and your attention.
Thank you so much. I am very happy that our panel live being, we kept to the time, exactly to the hour. I am very, grateful to the speakers, to every single one. I think several of them had their last comments around the global plan, around the key messages to the G20 that were coming in their last slides. I know that in their last points, I know that there will be a summary of what we discussed here. And I know we have a very strong call to action. This was just the first panel of several panels that are coming today and tomorrow in highlighting the need for a specific focus on financing for TB. For everyone in the attendance and for the G20 representatives to this meeting, as this year, as well as next year when India will host, as well as in 2024 when Brazil will host, we really hope that there will be a continuity in the conversation and the focus on the financing for TB. We are here in front of you sharing all the thinking that we have, but it is time that we are not anymore silent in the fact that we will not be able to end this disease, which is also airborne, which also infects many other people if we are not able to put the money in place. With this, I am thanking everyone for their presentations and contribution, and I pass to our colleague, the main host of the event. Thank you very much.
Thank you. Thank you for Lucica Ditiu as the leader. Thank you. Applause, please, ladies and gentlemen. Also, thank you to our speakers in the first session, and we're going to move to the second sessions. We will talk about alternative and innovative approaches to expand the financing to end tuberculosis. And to discuss this session, we have all speakers like shown in the screen. right, ladies and gentlemen, those are our speakers for the second session. The first one is Feng Zhao, Practice Manager, World Bank. Benjamin Coughlan, Senior Health Specialist, Asian Development Bank. Jonathan Tahir, Deputy Chair, Tahir Foundation. His Excellency Jose Antonio Gonzalez Anaya, Economist and former Minister of Finance, Mexico. And to lead this session, ladies and gentlemen, I would like to invite special staff to the Minister of Health on Healthcare Services, Ibu Prastuti Suwondo. And for your information, ladies and gentlemen, we provide 5 to 7 minutes to each speaker to speak, and also still we provide you the sound of gamelan instrument on screen as the reminder for the speakers to wrap up the presentations. So for now, inviting Ibu Prastuti Suwondo, the floor is yours.
Thank you so much. Yeah, thank you so much. Thank you for your patience, and I will promise that I will finish this session by 7 o'clock. So we will go together to the gala dinner at Prambanan. Okay, let me start with the introduction. Yes, we start with the introduction. As we all know that tuberculosis accounts for the highest disease burden from infectious disease, only second to the COVID-19, with global mortality 1.5 million each year and 10 million people who felt ill each year. The G20 bears almost 50% of the global TB burden, as what just mentioned earlier, and full support to end TB in the member state would curb half of the TB epidemic. However, generally, low and middle income countries are disproportionately affected by TB, meaning these are where the bulk of TB incidence and mortality occurs. Unfortunately, as we all know, that inadequate financing remains one of the most barriers to end TB. In between 2018 and 2020, globally, we reached less than 50% of the funding targets for TB care and prevention, as well as TB research and development, as mandated in the UN high-level meeting outcomes, the political declaration on the fight against TB. Consequently, as noted in the previous session by Dr. Fujiwara from the Global Plan to End TB Task Force, the world leaders need to mobilize at least fourfold of the current global investment and for TB care and prevention, amounting about 19.6 billion in 2023 to 2030, as well as quadrupling the funding for TB research and development amounted to 4 billion each year. A repeated lack of investment in TB, even with numbers estimated prior to the pandemic, will result 31.8 million TB deaths and will cause a loss of 17.5 trillion in global economic from 2020 to 2050. Therefore, the cost of TB, a preventable and curable disease, to health system, business, and individuals will be higher and growing if we continue business as usual in our investment and implementation to curtail in the TB epidemics. So the lack of commitments and investment to improve patient-centered access to tools in preventing, reaching, and curing TB patients will lead to delay in patient access in diagnosis and treatment, which has costs affecting individual patients, their household, and eventually their nations. Therefore, there is a pressing necessity for the new innovative approach to address the large funding gap in TB response. Financing for TB response needs a multi-sectoral and system approach at all levels to reach the most at-risk population, which is a fundamental component of providing effective universal health coverage. So in this session, we discuss alternative and innovative approach to expand the financing to end tuberculosis. And we have here our distinguished speaker. We will hear from them about the available and potential innovative mechanism to mobilize the resources needed and to match the rising needs from the public and other funding strategies. So we are very fortunate for this session, the last session for today, to have 4 distinguished speakers that willing to share experience, perspective, and more importantly, share their innovative approach to expand the financing to end TB. The first speaker is Feng Zhao. Hopefully that I spell your name correctly. Okay. He is the practice manager of health, nutrition, and population global practice from the World Bank. I will invite Mr. Feng Zhao, our first speaker, to deliver his notes. I have to remind that your time is about 7 minutes. Thank you so much.
I'm very excited to be here to share some reflections and thoughts about financing TB at an extraordinary time. On the one hand, we still have an active pandemic with us, and COVID has not disappeared yet. On the other hand, we know the interruption of essential services has been across the board. We have multiple challenges, and TB is one vivid example. What we have now, you think about it, is not only the essential services has been interrupted, but also we are facing a tremendous challenge because we just published a report to highlight this. We are not only encounter a health challenge, but an economic one. Because the stagnation or interruption of economic growth and revenue has decreased, and that end in maybe either stagnation of health financing or maybe decreasing in health financing because there's so many needs. During the pandemic, we have been struggling to handle both health shocks and economic shocks, and we lived through that. So it'll be challenging down the road in terms of the physical space, in terms of health spending. And we predict in some countries, maybe we can see some increase in health spending, but in most of the countries, there's a huge question mark about how the health financial trend will play out. So we have to take those into account, into our consideration and the policy deliberations. Now, I want to share some maybe reflections, and we can call it lessons learned from COVID in terms of financing, and then I will zoom in TB program specifically and share some thoughts of how we move forward collectively. If you think about what we have done in the past 2 years in terms of financing COVID interventions, one thing we can build on is there has been a global effort. In the beginning, there was a quick response from almost all angles. We learned from Ebola, we learned from SARS, we learned from other health crisis, build on those experience. The response to COVID has been, in my view, has been extraordinary. I know governments has put in significant financing to finance COVID response. Private sector has chipped in to finance all those very critical tools, including vaccines, diagnostics, and therapeutics. I know our research institute has really contributed. The reason we can get here right now is because we managed to have those tools very early. And we see international players also chip in to finance COVID response very significantly. I can give the example of the World Bank. During the early phase, in 100 days, we put in $6 billion for health emergency. Over 100 countries has benefited from those financing. For vaccine phase, we put in $20 billion, and right now we have close to 70 countries has benefited from not only vaccine procurement, but also vaccine delivery. As we know, vaccination saving lives, not just vaccine. We have to get vaccine into people's arms. And right now, we're discussing how we systematically financing pandemic preparedness to create a resilient health system. And I know Global Fund has put in CRM 19 to also finance COVID response. Those are just examples, but it has been all hands on deck to handle global health challenges. And in TB, it's not the same picture. As our host has just highlighted, we need much more financing for TB, fourfold more, as some colleagues has estimated. We need to reflect on COVID financing vis-a-vis TB financing to see what we can learn from COVID, why TB is falling behind, and what we can go from here. So that's one reflection I want to share. The second one is we recently published a universal health coverage global monitoring report jointly with WHO. We have indicated, based on the data, even before COVID, we have over 1 billion people suffering health hardships from seeking health care. This is the number we have never seen. This is historically high. This is even before COVID, and COVID has even worsened the trend. So we're off track to reach universal health coverage. So the agenda is coming back strongly. We call it Build Back Better, but essentially is we have to address both COVID, which is still with us, but also universal health coverage, health sector's reform agenda. We are falling behind in many fronts. So that's another challenge facing us. We cannot afford to be single-minded at any point of time, even during an unprecedented pandemic. TB has been a challenge even through the peak of the pandemic, has been a challenge, has not disappeared. It's still killing millions of people. I don't want to repeat all those horrible statistics which many leaders has clarified throughout this event. So the challenge is still with us. The problem for health is we always facing multiple challenges. We have to learn we can be capable or adaptive to handle multiple challenges. And financing is a big part of it, despite all the challenges. So that's my second sort of reflection from COVID. The third one is global coordination is much needed. Learning from COVID, I can use the example of ACTA, the Access to COVID tool, has been a very effective, global effective, which all global health agencies and leaders, organizations, both at global level, regional level, and country level, come together to come up with a strategic response and also come with sensible financing, which so many countries have really chipped in to provide much needed financing for vaccine, therapeutics, and diagnosis. We need to learn those coordination mechanisms. Maybe similar coordination is also needed for TB. We can really tackle this, also a global challenge, more holistically. Now, let me maybe just share 3 thoughts, particularly on TB. Right now, the global conversation is dominated by pandemic preparedness, how we build a resilient health system, which is not only address health crisis, but also will be robust enough to continue to provide essential services, including TB, through or during a health crisis like COVID pandemic. The more we integrate TB services.
I'm sorry. Apology for to intervene. That the time is in 1 minute. Can you complete?
Yes,
please?
absolutely. I'll wrap up in 1 minute. Thank you so much. So the more we integrate TB service into primary health care, into our service delivery system, the more we give TB a hope, as many colleagues has already mentioned. We have a lot of health service delivery innovations which also apply to TB. So that's one. The second one is financing is important, but also some of the innovations is also critical in terms of TB. At the World Bank, we have done some allocative efficiency studies for TB. By simply relocate TB financing to some highly effective interventions, such as outpatient interventions, we're able to achieve maybe even same or better results. So this is why I said the efficiency agenda is also critical important. The last point I want to make is the policy dialogue analytical work need to lay a foundation to guide our TB intervention and guide our financing. Many partners has done country level TB analytics, and those has provided strong evidence and science to TB intervention. And to me, some of those findings are much more important than financing. To have policy changes, of course, financing need to back up those reforms, but let's never forget those very meaningful analytical work, studies, many of you have been conducting at the country level, which will guide everybody, including us as the financing institution, to allocate resources. Let me stop here. We'll be very happy to answer any questions you may have. Thank you.
Thank you so much, Mr. Feng Zhao, for your speech. It is a great hear from you to on the sustainability financing and the global cooperation to continue address the multiple challenges to overcome TB adaptively through innovative financing solution. Thank you. Now we are moving to the second speakers. I would call Mr. Benjamin Coughlin, Senior Health Specialist from the Asian Development Bank. I will invite Mr. Benjamin Coughlin. The floor is yours. 7 minutes, please. Thank you.
Sure. Well, it's a great pleasure to be here at this very important side meeting event on TB. So it's now just over 2 years since we've been battling the pandemic, and COVID's clearly impacted health systems and economies profoundly. So that not only illuminates the gaps in our public health spending, but I think, with a pandemic and infection in all corners of the globe, we've highlighted how investing in health in new ways is incredibly important, not just for the health of individuals, but for economies and normal social functioning. But the pandemic should have also highlighted us to other endemic public health crises, such as tuberculosis. And I think you probably already heard this in earlier sessions, but TB has killed in Asia Pacific something like 60% more people in the last 2 years than COVID has. Also, 60% of the world's global cases of TB come from the top 6 TB burdened countries in our region. So in order to impact on TB control globally, we must address TB in Asia Pacific. So at the Asian Development Bank, we see this as a core health priority. The first challenge we've looked at really is getting TB services back on track. So the indirect effects of COVID-19 have disrupted essential health services. For instance, in the People's Republic of China, some 27% of all TB patients postponed or missed follow-up examinations due to the fear of contracting COVID or the cessation of services. And WHO tell us that for the first time in over a decade, mortality from TB has gone up due to misdiagnoses and missed opportunities for treatment. And unfortunately, a lot of that TB burden is in our region. So the top 3 countries contributing to this global underdiagnosis and underreporting of TB were India, Indonesia, and the Philippines, all in Asia Pacific. And a recent study said that some additional 6.3 million TB cases and 1.4 million TB deaths could occur between 2020 to 2025 due to the lingering impacts of this period of the pandemic. So the other challenge we see is obviously the focus of this session is getting TB funding to where it needs to be. So in responding to COVID-19, there was mass diversion of public health funds, including and especially for the control of other communicable diseases. So global spending on TB services dropped between 2019 and 2020, and more than half of the world's 137 low and middle income countries continue to report budget deficits in rolling out their national TB plans. The largest gaps, again, in these budget deficits are in the Asia Pacific region. So Indonesia reports some $318 million shortfall for their TB program, the Philippines 152 million, and the People's Republic of China 109 million. So what is ADB doing about it? And here I kind of blend in the pandemic because it's still with us and not going away. And I think we need to be cognizant of that when we're planning our financial responses. So the first is to maintain some flexibility in the face of the pandemic. And that means integrating responses where appropriate and applying innovation that we've seen emerge during the pandemic as rapidly as we can and scaling up the successful programs. So we have a few examples from our region that ADB has supported, including India's telemedicine program, eSanjeevani, which was rolled out originally for COVID-19 patients, but quickly adapted to include screening and follow-up of patients with tuberculosis. So that resulted to improved access to care and improved service delivery. So part of what we're doing is trying to identify these innovative programs so that we can lend support to scale them up. We also, and I guess this blends in the ongoing COVID response with the tremendous need for TB and longer system planning for health services, which will benefit both diseases and other health issues. So that's to take advantage of this moment to invest in health systems. At this point of the pandemic, with a milder variant and many countries increasing vaccine coverage rates, especially across Asia Pacific, we're at an inflection point where we should ensure that COVID-19 and TB are not competing agendas. So we should attempt to leverage many of the common investments in health services to address both diseases. So some of these initiatives now that countries are beginning to think about, and they didn't have the space with it for the last 2 years as they struggled to get vaccines, is to invest in National Institutes of Public Health or National Centres for Disease Control to improve surveillance, diagnosis, and community-level responses to address both COVID, TB, and other diseases. At ADB, we established a $9 billion fund to secure vaccines for Asian Pacific states. We've dispersed close to $5 billion of that money, and we're now looking at how we spend the residual $4 billion of that. And this really is pivoting to longer-term investments for health system strengthening, pandemic preparedness, and pharmaceutical manufacturing. So many countries, seeing that they couldn't access vaccines last year, are now wanting to develop a sovereign capacity to develop their own vaccine manufacturing capabilities and pharmaceutical capabilities. We're trying to blend that desire for the manufacturing components with strengthened regulatory systems and clinical trial capacity. These investments are very much likely to advantage responses to TB. Now, as Feng Zhao said in the last session, it's by no means certain that national health budgets will be able to rebound from the COVID and maintain such high levels of spending. So this is a potential threat. At ADB, however, we have committed to increase our overall health sector portfolio from something which sat around 1 to 2% of the total ADB portfolio up to closer to 6 to 10% of the portfolio for the future. So we recognise that there is a need to supply the finances for countries, and we will encourage our developing member countries to seek technical assistance and loans and grants from ADB to invest in tuberculosis. Now, the final point is that we are in the process of starting off our next 10-year health strategy. So that really is moving to more people-centred approaches and driving towards universal health coverage. And that includes investments in primary care as well as health insurance coverage. TB is a major contributor to catastrophic health expenditures for families in our region. So we want to make sure that families have sufficient cover to avoid those debt traps. The remit of our Sustainable Development and Climate Change Department at ADB is to improve the lives of people in Asia through the generation of new knowledge, through new partnerships, and through identifying and applying the best innovations. So we look forward to working with you all on these solutions for our member countries in Asia and Pacific. Thank you.
Thank you. Thank you so much, Benjamin Coughlin, for your speech. It's wonderful to hear your remarks on the importance of TB response that need regional and the global collaboration. It's also great that IDB provide an integrated response to address the health problems. Thank you. Let's us move to the third speakers. We have Jonathan Taher, the Deputy Chair of Taher Foundation with us today, and he's also his leadership in Mayapada Group. He's active in philanthropy through the foundation. So I will invite Jonathan Taher, our Mr. Jonathan, the floor is yours. 7 minutes, please. Thank you.
Terima kasih. Selamat malam. Good evening, ladies and gentlemen. Thank you for this opportunity to be able to participate in this session. It's truly an honor to share some of our lessons learned with such distinguished panelists and guests. As an introduction, maybe a lot of you are not familiar with us. My name is Jonathan Taher, and I co-chair the Taher Foundation, an Indonesian family foundation that focuses on education and healthcare. As a background, we partner with the Gates Foundation and the Global Fund since 2015. And we're happy that we were able to participate as well in the last replenishment round 3 years ago in Lyon. Our humble contributions have been able to support Global Fund's effort in Indonesia to fight HIV, TB, and malaria. So I would like to thank the Global Fund for this noble opportunity. Our foundation's point of view is quite simple. A healthy and prosperous Indonesia benefits everyone. It benefits the people of Indonesia, and it benefits the region as a whole, having a strong and healthy Indonesia. Having a large productive population can be very beneficial, but we can't afford to fall into the middle income trap. We appreciate the support of the Indonesian government and other governments as well in tackling health issues. But we feel that that's not enough, even though that's a lot. There's a part to play from the private sector. And the private sector cannot just stay idle and reap benefits on the side. There needs to be a calling towards the private sector to do its part and become part of the solution. That's why, as the largest private foundation donor from an emerging country in the last replenishment round, we are proud to be able to play a part, albeit a small part. As a side, besides co-chairing the family foundation, I do business on the side job as well. And one of the frequent indicators for any investments is the ROI, return on investments. And I'm sure all the bankers before me are very familiar with this. And I truly say that the ROI, the return on investments in fighting TB in Indonesia is very crystal clear. It's one of the highest death contributors and kill over 1.5 million a year. And we've seen firsthand how COVID has interrupted a lot of progress globally. But for me, I would like to see it as a glass half full point of view. We have to be able to double down, and the time is now, I believe, because this is the new normal. COVID has shifted a lot of our behavior and tendencies, and technology is the fundamental driver. I do hope that in the future we can use our technologies to our advantage to be able to tackle TB issues. Like it or not, health and economies have a positive correlation, and we need to be able to address them accordingly. We can't have one without the other. As just now, as our panelists have said, we've seen firsthand how countries, government, and private sector has come together to be able to successfully fight COVID. Similar fight will be needed to fight tuberculosis, and it can be done. I do hope that the good progress in fighting TB in Indonesia can encourage other countries to partake and support in the upcoming replenishment program for the Global Fund. As Indonesian, I thank all of you, the existing donors here. I'm sure there's a lot present today. And I also thank you and humbly ask for your renewed support from both existing donors and also new donors, as our country still needs them. Only through active partnerships we can successfully battle TB together. Thank you.
Thank you. Thank you so much, Jonathan Tahir, for your speech. I totally agree that health and prosperous Indonesian that benefit everyone. The support for private sector is indeed playing a vital role to eliminate TB in Indonesia. Thank you again. And lastly, the fourth speaker, I would like to invite His Excellency Jose Antonio Gonzalez Anaya, an economist and former Ministry of Finance from Mexico. He is currently also the CEO of EZ at the Televisa Groups, one of the largest telecommunication companies in Mexico. I will invite His Excellency Jose Antonio, our last speaker, to deliver his notes. His Excellency, the floor is yours.
Thank you very much. I want to thank everyone for the invitation. The last time I was in Indonesia, I was the minister and we were at the annual meetings. So the first thing I want to say is that this is the contribution from a former Minister of Finance, not an expert on health and certainly not an expert on TV. But the first thing I want to say, like everyone else, is that the COVID pandemic has highlighted the critical relationship between health and economic performance. If we had any doubts, the last 2 years have made us think that there is a very strong link. I want to make two very broad points. The first one is that this COVID and TB highlights the urgency for improving the dialogue between health sector leaders and macroeconomic leaders. And I think this is an issue that has been long overlooked. It is, for all of us, it is almost obvious, both from the health sector and from the macroeconomic perspective, that good macroeconomic performance brings better health. Wealthier is healthier, and better health brings good macroeconomic performance. Healthier is wealthier. But in many countries, the ministers of finance simply give line ministers a budget envelope and then not intervene in the rest of the execution of the budget. And this leads to little constructive dialogue. As ministers of finance, we need to get more involved in health policy decision-making. And as health says, both an opportunity for better economic performance and a major risk, as COVID has shown. At the same time, I believe that ministers of health should also broaden their scope to realize that health is not just healthcare, and it's not just healthcare for particular areas, but it is multi-sectoral approach across all sectors, and not only publicly financed healthcare. We have seen from many of our speakers how technology, the private sector, I would go even further, regulations on insurance, regulations on pharmaceutical providers, etc., can make such a big impact. The second point I want to make, and it has been brought up, but I want to make it from a slightly different point of view, which is that the decision-making progress for both donors and governments, it has struck me we need to reprioritize and ensure that there's a rational allocation of resources. Development assistance for health internationally must be based on evidence on health, on poverty, and the impact on socioeconomic development. And at the same time, government allocations must also be prioritized based on evidence. We have seen on this panel, but especially on the previous panels, the huge impact TB has on health, on healthcare, on lives. And one of the main reasons I accepted this kind invitation to participate in this forum, as I said, not as a health expert, is that when I look at the numbers, I was surprised by what seems to be an asymmetry in the allocation of resources among key disease priorities, with TB having a lot less funding than other conditions that are important but don't seem to have as big an impact as TB does all over the world, and especially among the poor. So even though I'm not a health expert, I know about numbers, and the numbers between impact and resource allocation don't appear to match. Moreover, TB is a disease that is very closely associated with the poor. And, you know, as health experts, as ministers of finance, we should care more about what affects the poor for all kinds of reasons, most importantly, lives, but also because people can be pushed into poverty if one member of the family contracts this disease. The out-of-pocket expenditures for TB compared to other diseases that receive a huge amount of funding seems out of the ordinary. So I think it is imperative that we revisit our prioritization and ensure that there is a rational allocation of resources based on impact among those who have a strong voice in global health and those who don't and are marginalized. One of the things that is very interesting about TB as well is the prevalence it has in different parts of the world. I come from Latin America, and although TB is still prevalent and COVID regressed some of our progress, the region in general is in a better position for TB. However, as my colleague Tahir showed, in Asia and South Asia and in Africa, they still face an enormous challenge. So I urge all of us to work on these two things. There's a lot to be gained from improving the dialogue between health experts and financing experts and the people in charge of macroeconomic stability in countries. And secondly, we also need to reprioritize and ensure that there is a rational allocation of resources, both at the government level, but also at the international development donor level. I thank you very much for your kind invitation to participate in this, and I hope we can all continue to work on eradicating this disease that affects the poor so disproportionately. Thank you very much.
Thank you. Thank you so much, His Excellency, for your speech. Thank you for delivering the point of the urgency to include dialogue between health sectors and macroeconomics for major health response. such as what you just mentioned, COVID-19 and TB. Yeah? It is also important for both donors and government to have a robust collaboration. Thank you. I would like to convey my gratitude to all distinguished speakers, Feng Zhao, Benjamin Coughlin, Jonathan Tahir, Jose Antonio Gonzalez Sanaya, His Excellency, who has provided an important insights on the innovative approach to expand on the financing to end the TB, and also suggestion on how we can increase and make the best possible use to maximize the investment to accelerate TB elimination. Thank you very much, and I close this session, and I'll give back to the host. Thank you.
Okay, applause please, ladies and gentlemen. Thank you, Ibu Prastuti, for leading the second session. Ladies and gentlemen, our honorable guests and participants for the first Health Working Group side event tuberculosis. Once again, we would like to thank you very much for your meaningful and highly valuable participation in the entire session of the side event today. We are now, ladies and gentlemen, heading to our last side event TB agenda, which is we're going to have dinner reception that will be taking place at Ramasinta Restaurant Prambanan. The trip takes around 30 to 35 minutes, and we have provided the transportation. For delegates, please visit the lobby, and for the non-delegates, please proceed to the back entrance to get the transportation. We really hope that you will enjoy your dinner this evening. So right now, ladies and gentlemen, once again, thank you very much, and I'm Santi Zaidan. I'll see you again tomorrow. Wassalamualaikum warahmatullahi wabarakatuh.
Bang.
Wah, udah pada kumpul.
Iya dong.
Iya dong.
Ayo.
Kak, gimana kalau kita minum dulu?
Ayo, boleh.
Sebelum nyanyi. Cheers dulu dong.
Cheers. Cheers. Apa kabarnya, Bang?
Ya, begitulah, Mayan.
Yaudah, kita nyanyi bareng ya?
Ayo. Bentar. Gimana kalau kita main truth order aja?
Ayo, gas.
Lebih seru kan? Aku putar botolnya ya. Ya,
Om kena.
Ayo kena. Ibu kena. Ibu kan gak ikutan.
Ayo lagi.
Ya, kakak kena tuh. Ya, kakak kena tuh. Kakak kenapa sih? Kok dari tadi batuk-batuk terus?
Nggak tahu nih udah 2 minggu kayak gini terus.
Wah, harus segera cek ke dokter, Bang.
Iya tuh bener.
Iya nih.
Setiap orang berpeluang yang sama mengalami TBC. Yang perlu disadari, risiko kita untuk terpapar cukup besar. Semakin segera cek, semakin cepat sembuh. Ingat 14-1 cek TBC. Jika 14 hari batuk tak reda, satu solusi, cek dokter segera. Ayo, temukan TBC, obati sampai sembuh. 14 hari batuk tak reda, satu solusi, cek dokter segera. Segera cek website di 141.stoptbindonesia.org kami.
We are dealing with diseases that knows no borders. We are dealing with diseases that know diseases that knows no borders.
আমার নাম মোহাম্মদ আসাদ মিয়া। আমার জীবনে সবচেয়ে গুরুত্বপূর্ণ আমার পরিবার। আমি একজন স্বামী, আমি একজন ছেলে, আমি একজন বাবুর্চি। আমি যক্ষ্মা থেকে সুস্থতা লাভ করছি। বেশ কয়েক মাস আগে আমার মা খুব অসুস্থ হয়ে পড়ছিল। তখন আমার পাশের যে ক্লিনিক আছে, ক্লিনিকে নিয়ে গেলাম। ডাক্তার কিছু টেস্ট দিল। তখন এই টেস্টগুলো ছিল খুবই ব্যয়বহুল। তো ওই মুহূর্তে আমার কাছে কোনো টাকা পয়সা ছিল না। তো আমার শেষ একটা সম্বল ছিল চটপটির গাড়ি। সেই গাড়িটা আমি বিক্রি করে দিলাম। বিক্রি করে দিয়ে আমার মার ওই টেস্টগুলো আমি করালাম। তো ব্লাড টেস্ট করানোর পর বললো যে ব্লাড টেস্টে কোনো সমস্যা নেই, আপনার আম্মাকে সাময়িক এই ওষুধগুলো খাওয়ালে ঠিক হয়ে যাবে। তা 3-4 দিন খাওয়ালাম, খাওয়ানোর পরও কমলো না। দেওয়ার পরে তারপর সুস্থতা শুধু পিছনে যাইতে চাই। ওর মধ্যে আবার করোনা চলতেছে, তখন আমার সম্পূর্ণ ইনকাম সোর্সই বন্ধ হয়ে গেল। এই মুহূর্তে আমার তেমন একটা চিকিৎসা করতে পারি নাই। আমার শেষ সময় যে ব্যবসাটা ছিল সেটা আমার হাতছাড়া হয়ে গেল। আমি সব দিকে অন্ধকারে গেলাম। এর মধ্যে নিজের শরীর অবস্থা তেমন একটা ভালো না। নিজে খুব অসুস্থ বোধ করতেছি। বুকে ব্যথা, সর্দি, কাশি। আমার অবস্থা ওই সময় যে অবস্থা ছিল, মানে খুবই কষ্ট। যেটা আমি বলতেছি এটা আমি বাস্তবে অনেক ইচ্ছে বেশি কষ্ট করছেন বাস্তবে ওই মুহূর্তে। তখন আমার এই অবস্থা দেখে আমার পাশের একজন আমাকে এসে বললো যে আপনি ব্র্যাকের একটা আপা আছে। তখন উনি আমাকে ওনার সাথে যোগাযোগ করিয়ে দিল। টিভি ক্লিনিকে নাম ওনার শাহনাজ আপা। কফ পরীক্ষা করালো আর এক্সরে করালো। করানোর পরে সেখানে আমার বললো যে আপনার তো যক্ষ্মা হয়েছে। তবে আমার আম্মার যে সমস্যাগুলো ছিল সেই সমস্যাগুলো শাহনাজ আপা দেখে বললো আপনি যে কোনো একটা ডাক্তারে দেখান। তখন ডাক্তারে দেখালাম। দেখানোর পর ওই ডাক্তার বললো যে আপনার আম্মার যক্ষ্মা হয়েছে এবং ফ্রিলি ওষুধগুলো খাই। প্রতিদিন 3টা করে ওষুধ আমাদের খাওয়াতো 6 মাস। 6 মাস একটানা খাওয়ার পর তখন আমরা সুস্থ হয়েছি। যেহেতু এখন আমি এবং আমার মা আমরা দুজনেই সুস্থ, এখন আমার মনে অনেক সাহস আছে, শক্তি আছে। আমার একটা দোকান আছে, চটপটি দোকান। আমি মনের দিক দিয়ে এখন অনেক খুশি। আমি এখন সুস্থ, এর বেশি কিছু না। যে কোনো মূল্যে আমি লড়াই করতে এখন প্রস্তুত। আমার পরিবারের জন্য, আমার মায়ের জন্য, আমার নিজের সুস্থতার জন্য।
The doctor said that there's no need to worry because tuberculosis is treatable and curable. I just need to take my medicines and eat well. But tuberculosis makes me feel lost and alone. I miss my friends so much.
Seryoso ba yan?
Oh no. Uy, Nico. Oh, Nico.
Am I strong enough to overcome this? But I was never alone in my journey. I was so afraid I would lose my friends, my love. But I was wrong. They invested their love, care, and support for me. I was so happy to hear that I was free of tuberculosis.
Inna lillahi wa inna ilaihi.
Selamat jalan, Bapak Arifin. Semangatmu akan selalu hadir dalam perjuangan kami untuk mengakhiri TBC di Indonesia, bahkan di dunia. Bahkan di dunia. TBC di Indonesia, bahkan di dunia. Akan selalu hadir dalam perjuangan kami untuk mengakhiri TBC di Indonesia, bahkan di dunia.
cek lagi cek hey cek hey oke cek hey terus backing vokal ngene keyboard ning drum tambah Mas
cek hey